డిసిప్లిన్ కమిటీ మీరు కూడా ప్లీజ్.
నువ్వేం చెప్తున్నావు మరి? నువ్వేం
Hello. Hello. Hello.
Hello, check.
Hello.
I request everyone to please put your phones in silent mode. once again a warm good morning and hearty welcome to the day 2 of Second International Symposium on Advances on Chemical and Pharmaceutical Research, organized by and at Mallareddy Institute of Pharmaceutical Sciences, a constituent college of Mallareddy Vishwavidyapith. I am Mrs. Revati, Department of Pharmaceutical Chemistry.
I, Dr. Y. Sirisha, Department of Pharmaceutics.
Together, we welcome all of you once again. Without much delay, let's get into the sessions of the day.
Today's first speaker of session 1, day 2, is Dr. Chella Suresh. It gives me immense pleasure to introduce our speaker. Dr. Chella Suresh Garu is a distinguished biochemist specializing in nutritional biochemistry and molecular toxicology. He earned his master's degree in biochemistry and PhD in biochemical toxicology from Sri Venkateswara University, Tirupati in 1993 and 2003 respectively. He was also a gold medalist. In 2020, he was awarded a Doctor of Science in Biotechnology by Berhampur University. Currently serving as Scientist G and Director Grade at the ICMR National Institute of Nutrition, heading the Cell Biology Division, and have been contributing to ICMR for over 29 years. His areas of interest are biochemical toxicology and nutritional biochemistry. Dr. Suresh's research broadly focuses on development of natural and alternative therapeutic molecular strategies for the prevention and management of osteoporosis and molecular mechanisms underlying the crosstalk between mitochondria, lysosomes and endoplasmic reticulum stress in brain function and strategies for neuroprotection against late PP-induced and A-beta-associated neurotoxicity with direct implications for Alzheimer's disease and other neurodegenerative disorders. He has successfully led multiple extramural research projects funded by DST, DBT, ICMR and DHR, and has significantly contributed to addressing critical public health concerns including osteoporosis and Alzheimer's disease. His pioneering work has been widely published in reputed scientific journals. Dr. Suresh Garu has received several prestigious fellowships including the NIH Visiting Scientist Fellowship USA twice in 2004 and 2010, where he conducted advanced research on lead toxicity and its role in Alzheimer's disease progression. He was also awarded the ICMR Young Biomedical Scientist Fellowship in 2014. He is an elected Fellow of the Royal Society of Biology, FRSB, UK, Fellow of the Association of Biotechnology and Pharmacy, and Fellow of the Telangana Academy of Sciences. He is actively engaged in the scientific community, serving on several national committees and advisory boards. Dr. Suresh, serving as a professor at the Academy of Scientific and Innovative Research and ACSIR, coordinator of MSc and PhD programs at ICMR NIL. As an accomplished mentor, he has supervised 11 PhD scholars to completion, with 4 researchers currently working in his lab. Beyond his research and academic contributions, Dr. Suresh is a certified GLP inspector for NGCMS District Government of India and a CCSEA nominee for Animal Ethics Committee under the Ministry of Animal Husbandry Government of India. He actively collaborates with biotechnology and CRO companies on regulatory and ethical aspects of biomedical research. So with a huge round of applause, please welcome our speaker of the day onto the dais. Welcome, sir.
I request our Honorable Dean Sir, Dr. H. Ramana Garu, to please come onto the dais and heartily welcome the speaker of the day, Dr. Chella Suresh Garu.
I request our Dean Sir to hand over a token of love to Dr. Suresh Sir.
A round of applause, everyone. Hearty welcome to you, sir. It's an honor for me to introduce the chairperson of this session, Dr. K.N. Venkateshwar Rao Garu, the professor and principal at NS College of Pharmacy, who has an experience in academic leadership, curriculum design, institutional development, and regulatory compliance in pharmaceutical education. He has authored over 155 research publications, holds 5 patents, and co-authored several textbooks reflecting his significant contributions to pharmaceutical sciences. As a committed academician, he has guided 45 plus MPharm and 75 plus BPharm research projects, playing a key role in shaping future pharmacy professionals. Dr. Rao has actively contributed to national academic and regulatory systems as Inspector, Pharmacy Council of India, CCSEA nominee and NAC assessor, and serves on multiple boards of studies. He is a lifetime member of several professional bodies and an editorial board member for reputed journals. Advisor and member, Board of Studies, School of Pharmaceutical Sciences and Technology, Mallareddy Vishwavidyapeeth deemed to be University, and member, Board of Studies in Pharmaceutical Sciences, Narsarao Page Institute of Pharmaceutical Sciences. He has also contributed to academic excellence through conference presentations, faculty development programs, and initiatives supporting student placements at national level. His achievements have been recognized with honors such as the Global Eminent Academician Award and Best Achiever Award. May we request our chairperson, Dr. K.N. Venkateshwar Rao Garu, to please come onto the dais. Alongside, I also request our Honorable Dean Sir to heartily welcome the chairperson.
We welcome you, sir.
Without much delay, may I request our Honorable Dean Sir to talk a few words for the day too.
Thank you, ma'am. Respected today's guest speaker, Dr. Suresh Sir, and Chair, Dr. K.D. Rao, and my dear young faculty members and my dear students. So, good morning, everyone. Yeah, I welcome all for this second international conference. So, as you know, we are enjoying yesterday and today the same thing is going to be continuing. I request everyone, especially participants. So, this is the session where we are going to involve kind of the Suresh sir and followed by the other Dr. Narendra sir, and we are going to get some online sessions also there. So better to utilize the opportunity and get interacted with even guest speakers, and you have to take away something from even this international conference. So once again, I congratulate or appreciate all the even organizers and student friends and even non-teaching for supporting this event and making it success. So thank you all. I hope you will get benefited today's session. So thank you one and all for this wonderful opportunity. Thank you.
Thank you, sir, for always encouraging us to move forward. I request our Dean Sir to please take his seat off the dais so that we can start off the session 1 of day 2. Thank you, sir.
అసలు డౌన్లోడ్ చేసుకోలేదు సరే నేను పంపిస్తాను
So good morning everyone. Thank you for introducing me to this forum. I welcome you all.
ఉండదు సార్ అయితే మీకు హల్దీ సేమ్ చెప్పారు కదా సేమ్
Hello. Yeah. So I'm audible. Okay. See today the topic which I selected for you is because I'm working in the area of toxicology for almost 25 years, and I closely work with the heavy metal like lead, and how it influences the kind of neurobehavioral changes in the brain. So I directly work with in my own in vitro models, and these studies explore with the brain cells how lead plays an important role in the modifying the inflammatory changes in the brain. And also we were aligning with your concept of the conference, and we try to present over the rosmanic acid effect in influencing the and modulating the information being generated by the lead. So because I've been working with the brain cells, this is a small area of work which I generated. The student who has worked with this particular work is in the US right now. He has been awarded doctorate, knowledge doctorate, and the title goes like this. The rosmanic acid as a moderator of neuroinflammatory pathways in lead and amyloid induced toxicity. And what is lead? Lead is a heavy metal, and there are several heavy metals. But lead plays an important role in the system wherever you see the paints, glass, pipes, the industry which is having lead in the lead manufacturing, which is a binding agent for the making of several chemical substances. And the amyloid-induced toxicity is amyloids are the proteins deposited in the brain during the Alzheimer's disease. In the beginning, when I was working in that area where lead only I was working with the brain cells, later in one of the conferences, one professor raised an issue because lead causes oxidative stress, inflammation, and apoptosis. A similar kind of situation is there in the Alzheimer's also. You know about the Alzheimer's, dementia, and Parkinson's, they are neurodegenerative diseases, and they also produces the oxidative stress, inflammation, and apoptosis. Suppose a patient with Alzheimer's living in a highly environmentally polluted area where lead is there and everywhere in the environment, what is going to be the situation with a particular patient with the Alzheimer's? Because these lead causes oxidative stress, inflammation, and the apoptosis, and also kind of regulation in the cell cycle, out of regulation, and also similar kind of situation with the Alzheimer's. When these two combine, the situation where in a simulated environment in the laboratory, what is going to be the impact on the inflammation? This is the basic mode of the study, and how nutraceuticals plays an important role in mitigating the toxicity being generated by the lead and amyloid peptides. Before going into the details of my research work, I would like to present very little brief about what is lead and how it plays a role in the toxicity, and then slowly I will go into my area, how it affects
the brain neurodegenerative progress. We know heavy metals are toxic to human health. We all know that they are non-degradable. Once they go into the body, they not degrade, they have to get excreted. And they show very serious health consequences. Like I'll show in my coming slides what kind of health consequences you will see. They are very toxic and poisonous, even very low concentrations also. In micromoles levels also, once they go into the body, they will affect different systems in the body. My interest is the brain, but it affects other systems also. And the most common heavy metals are lead, mercury, cadmium and arsenic. And you see, they pass into the body like through the contaminated drinking water, through the contaminated soils and industrial waste. Once the industry releases these toxic substances into the whatever in the ground, this will go through the water and seep into the soil, and these plants will take up all these heavy metals and we consume those plants. That's how it goes into the circulation. And you see the food sources like vegetables, grains, fruits. Audible? Voice is not sufficient like they are telling it's okay. So what happens here, see the food sources such as vegetables, grains, fruits, fish and shellfish, and this gets seeps into the surrounding soil. Through the soil it enters into this one and it goes to the lakes where fish also living. This will go into the fish what we consume. That's how it goes into the circulation. So they have deleterious effects including the growth and development, even if it causes cancer, organ damage, nervous system, even in extreme cases you can see the death of the person also. So these are produced by the different industrial activities and they just seep into the environment and that's how it goes into the human body. And you see what kind of toxicities you can see, arsenic, cadmium, chromium, mercury. I'm interested on lead and these through the inhalation and ingestion it goes into circulation and it affects all kinds of organs in the body like kidney, gastrointestinal tract, cardio. Many organs are being damaged here with these kind of heavy metals, and lead causes neurotoxicity and it also causes lung damage and liver damage. But I'm interested on the neurotoxicity and how it plays a role in the neurodegenerative progression. So you can see, if you see the lead poisoning, starting from the top to bottom, all systems have been affected with the lead. Once lead goes into circulation, it affects the vision, it affects unusual mouth systems also, blood, speech, and also affects kidney, neuromuscular changes, and reproductive changes, central nervous system, even it causes anemia. And in extremities like the wrist and foot drop, pain, tingling, everything, even skin also can change as well. So lead has got its effects like throughout the body, from top to bottom. It can show kind of toxic effects onto the system of the human. And what is the pathophysiology? How it really goes into the circulation? How long it exists in the, what is its half-life in the body? So you see, lead gets absorbed by the gastrointestinal and respiratory tract and skin and transplanted also. The pregnant woman gets exposed to lead during the pregnancy. It can cross the blood-brain barrier and goes to the fetus also. So the newly born child also gets affected with the lead poisoning because it can pass through the intraplasentally also. This is called a transplasentally. It can go to the fetus and from the childhood. The baby gets neurobehavioral changes and it will start acting differently. And because the brain function is altered. And you see here, it is normally not metabolized in the body. Once it goes into the body, it has to get deposited somewhere. Mostly it gets deposited in the bone because it can't go anywhere. It deposits in the bone and absorbed, distributed and excreted. So you see here, the bone is having bone, soft tissues and blood. You can see in bone it is 70 to 60% and it is 5 to 10% and blood is 5 to 10%. Blood 25 days it stays in the blood. In soft tissues is 40 days, membrane tissues 25 years, and through the diet, high fat diet, low calcium, magnesium, iron, zinc, mainly functions with the vitamin D synthesis, and also it plays an important role in the collagen synthesis, where collagen synthesis will get disrupted so that bone becomes weak, and also decrease the accumulated immunity. Immune cells like the polymononuclear leukocytes, that is PMNs, and also it kind of introduces the mitochondrial function. One of my students is working exclusively with the mitochondria, and another student is working with the lysosome and endoplasmic reticulum. These kind of organelles within the body which generate speed, energy, like ATP, these all will get affected with the lead interference. You can see what is neurotoxicity. Neurotoxicity is any kind of structure or function of central nervous system or peripheral system, whether it is a biological, chemical, or a kind of physical agent like lead. It's a chemical agent which can cause neurotoxicity, and you can expect unwanted effects in the body and diminishes the ability of an organism to survive, and it may cause neurodegenerative diseases also. And you see the brain, you all know the brain structure. Brain has got frontal lobe, parietal lobe, temporal lobe, cerebellum, and these all kinds of lobes having different functions in the body. Each is responsible. Like in these all different switches are there. Each switch is responsible for one place to get light. So in the body, the brain also, all the parts of the brain has got separate switches where the particular function will be affected. So you can see all kinds of things like, for example, cerebellum supports higher learning, mathematics, music, advanced social skills, and mental development. And for example, is the frontal lobe, the underdeveloped last part of the brain to mature, which has got effects of executive function, reasoning. These kind of things, each lobe is having a different function in the brain. This will be affected with the lead exposure. And so if you see what is Alzheimer's. Alzheimer's is a neurological brain disorder. It is a very common form of the dementia, and also it impairs the mental functioning, and it's very progressive. It's irreversible. Once you start with the Alzheimer's, it progresses very fast, and you can't make there is no treatment till now to treat the Alzheimer's or Parkinson's or dementia. So once it starts, your mental loss, memory loss will be there. An Alzheimer's patient looks very normal like us only, but memory loss will be there. Physically he will be fit, but mentally he is not fit. So like that, memory loss is the classical symptom, and decline in the thinking abilities. If you are thinking, if you can recognize this is mind, but the Alzheimer's patient cannot say that this is a mind, this is a pen. Like they can't see, they can't think properly and deliver the goods. So therefore, the thinking abilities also will be altered, and ultimately it leads to the changes in personality and behavior also. Let's see what kind of causes, what are the causes actually. It is interrelated factors like genetic factors. Mostly we can expect that genetic factors are there, but somehow now latest advances say that environmental factors also plays an important role in the progression of the neurodegenerative disease like Alzheimer's, and also lifestyle factors and dietary habits, and high blood pressure, high cholesterol. These are all associated factors where it influences the Alzheimer's progression. So Alzheimer's develops not in a single day. Just today it has come, tomorrow it will go, not like that. It is a very progressive. It develops for the many years inside the brain. After 40-45 only you will come to know that this person is having Alzheimer's because you started losing memory slowly. And what is the progress? It is a progressive, degenerative, and incurable neurological disorder. Only thing is, when you do certain nutraceuticals and antioxidants, you can just postpone it, but there is no treatment available. If you go to the doctor will give sedative. They will put the brain to sleeping mode. There is no only treatment available as of now. And see, the abnormal substance like amyloid peptides will get deposited in the brain, which causes the signal transduction, obstruction the signal transduction, causing signals from one neuron to other neuron. This amyloid deposited in between gets precipitated in the brain, which stops the signaling process. See, these are all players and candidates. You can see this is a normal brain, this is an Alzheimer's brain. You can see the signals, the connections between the one neuron to other neuron, which is used here. The amyloid peptides gets deposited in the brain, and it will not allow the signal gets These are the basics of that one. This gets built up in the brain and gets deposited here like this, and this will not have a kind of communication between one neuron to other neuron. That's how when you are saying something, it will not pass to other neuron, therefore you will end up with the memory loss. You see what is exactly happening inside the brain. You can see this is a normal brain, this is the Alzheimer's brain. You can be shrinkage of the brain in the area of cortex, is so severe, and the ventricles and hippocampus. These regions are very important for the memory function. So you can see here the cortex shows this one is showing here, and damaged areas involving in thinking and planning and remembering. This is the part where we can think, remember things and all, that gets very small in size, so therefore we will end up with the memory loss. And you see the hippocampus is this area, and hippocampus plays an important role for the new memories. You have seen something new, you try to put in the brain, after even years also you will recollect the part. But that particular part will become a very small size like this. So ventricles are cerebrospinal fluid spaces in the brain that also gets shrinkage, so that the brain doesn't have any kind of cushioning in the body. So you can see this is the lead. What kind of lead? Lead is about the nervous system, that is about the Alzheimer's. Now I will speak about little about the lead, how lead plays an important role. Lead is a multimedia pollutant, and the sources are glass, pigments, leaded paint, ceramics, makeup. Especially the women using makeup kits, very rapidly they put all kinds of things on the face. They have more of lead on the face, and they are getting affected with lead, which is causing neurotoxicity. So you can see here, the electronic components, batteries. You use battery, you have a phone in the hand, everybody is having a phone. The battery is having a lot of lead. So these batteries, cookware, whatever you cook in the kitchen, mostly women are getting affected. They will be using this cookware also, where lead is acting as a binding agent. So there also you can see. And what happens, the continuous exposure to the brain causes the neurotoxicity and the impairment of the hair functions, and it appears, you can see, the infants in adolescence. These are the causes, these are all the effects of this lead, like mental retardation, intellectual impairment, hyperactivity, encephalopathy, behavioral changes, and suppression of the cognition. All kinds of things you can see with the lead accumulation in the brain, because it is a neurotoxicant. You see, the mode of transmission is inhalation of lead polluted food, and the sources are like petrol, paint, pesticides, cigarettes, smoking, all kinds of things which you see every day. In the homes nowadays, you are ending up with putting bright colors in the home. This room is having blue color, that room is having pink color, this room is having yellow color. More of the colors in the home, more of getting exposed to the lead. So lead, you are getting exposed means your nervous system is getting damaged slowly. So, and other thing is very important thing is the women makeup kits. You have to beware of all those kinds of things. So, and the nervous system, reproductive system, respiratory system, expiratory system getting affected. But I'm interested in the nervous system. What kind of damages you can see? Oxidative stress, calcium, dyshomeosis. These are all my findings. I have many publications in this area. And loss of myelin sheath, cognitive behavioral function, all kinds of things you can see with the lead to the nervous system. WHO has declared there are 18 million people getting affected, 34 million by 2028, and India is going to have 5 million people by 2028. These are all the supportive studies, and what is the causative factor of the Alzheimer's disease is still unknown. So therefore, lead could be one of the important factors which can affect the progress of the neurodegenerative disorder like Alzheimer's. You can see there are several studies supporting that even the micromoles of the lead exposure to the body also can affect the brain and behavioral pattern and cause toxicity. You see, Alzheimer's is a progressive neurodegenerative disorder, and where loss of neurons, abundance of intranuclear fibers, like I said previously, deposition of the amyloid fibrils in the brain, all can be seen, and this loss of cognitive function and dementia. Ultimately, we see the Alzheimer's patient, once it is removable, means memory is lost, few years, the person will die. The ultimate result is death only. And this is the mechanism that how plates and tangles gets because the brain is still unknown. There is no treatment also available right now. So it causes the neurotoxicity and oxidative damage. Inflammation is one of the important things which causes in the brain. So the toxicity being resulted with the combination of the lead and amyloid peptides, which the study I am going to show the results which we did in the laboratory. Lead has been exposed, amyloid peptides separately, we exposed to the brain, and what is the cumulative toxicity we still is not being addressed. It's a big question mark. That will to unravel that. So these are neurodegenerative diseases, it's progressive and irreversible, and the loss of memory, cognitive function, behavioral changes you can see, and the plaque formation leads to neurotoxicity, oxidative damage and neuroinflammation, and also the neurotransmission is getting affected, and ultimately leads to the neurotoxicity. And if you see, because I have been working for the last several years, these are all my publications in this area, which I published in the lead and Alzheimer's area. Very recently also, in 2026 also we have a publication. And you see, in the nervous system, there are different kinds of cells are available. Neuronal cells and glial cells. And this is one slide where you can see the glial cells and neuronal cells. Neuronal cells plays an important role in the memory, the signal transmission from one neuron to other neuron. And these kind of like multipolar, bipolar, and the unipolar and pseudopolar. And the glial cells are like which plays an important role in protecting the myelin sheath of the brain, which gives the nutrients to the neurons. So these are all cells like astrocytes, oligodendrocytes, and microglial and endocrine cells. The microglial cells are very important to play around to reduce the inflammation or causing inflammation. That is the cells which I do and I grow them in the laboratory and we have tested out. We expose the lead and amyloid peptides to the glial cells and also neuronal cells. What kind of effects, the combined effects, which we got in the laboratory, I'm going to show in the coming slide. And how rosmarinic acid is a very commonly available nutraceutical which can reduce the toxicity also we are studying. And you can see the neuronal cells like multipolar, bipolar, pseudopolar and unipolar. I am not going into the details of this one. This plays an important role in the motor and sensory functions. And these are the microglial cells. You can see the microglial cell structure which plays an important role in the phagocytosis and reduce removal and cytokine and release and immune signaling. This is very important which can reduce the inflammation or causing the inflammation. And here the microglial cells, there are two kinds of things like M1 polarization and M2 polarization, pro-inflammatory and anti-inflammatory. You see more of M1 polarization, you see expect that more of inflammation in the microglial cells, and you see the M2 polarization which acts as anti-inflammatory. So these two pathways I have studied here, and which is playing an important role in the both pro-inflammatory and anti-inflammatory by M1 polarization and M2 polarization in the microglial cells. So what kind of the factors is playing here? Alpha, IL-23, these are all the biomarkers, and here these are all the biomarkers which we have studied in the laboratory with and without rosmarinic acid. And you see, like I said previously, the amyloid beta peptides and aggregates plays an important role in the activation of the microglial towards the M1 polarization. Once you try to stop the inflammation, which goes towards the M2 polarization, where anti-inflammatory like cytokines will come into the picture, try to protect the brain. So, which kind of parameters plays a role in protecting the brain, like nutraceuticals and oxidative, antioxidants? Those things can be tested out here because the M1 and M2 markers which are studied in the laboratory. I'm going to show that one here. And rosmarinic acid. What is rosmarinic acid? It is a water-soluble polyphenol and peptic acid and 3-hydroxyphenylactic acid, which is very commonly available. And you see the laminaceae family, you can see that one. And it is like sources like rosemary, basil, oregano and sage, lemon, mint. All these things are the sources for the rosmarinic acid. You can easily get in the household this one, which has got therapeutic and nutraceutical properties. which is an antioxidant, anti-inflammatory, anti-cancer, anti-diabetic, and anti-hypertensive. So these rosmarinic acid we have taken to exclusively show the effects of the anti-inflammatory and pro-inflammatory cytokines in the brain. So you can see these are all the rosmarinic acid effects. Like I said, these are multiple effects, but I am interested on the anti-inflammatory effects and antioxidant effects in the brain. And how we started working in the laboratory. We have started working with we have taken neuronal cells, we have cultured them in the laboratory, and we expose the lead to the cells from a lower concentration to higher concentration, and we found that the lead exposure to the brain cells, and we have checked viability in the laboratory and in vitro systems, and we found that lead is causing oxidative stress, and the cell viability is going down. It is cytotoxic agent also, and even lower levels, even 1 micromolar level also, it is causing the cytotoxicity. And you can see the different time intervals also we expose the lead to the brain cells, and we observed that 50% death with 5 micromoles, which indicating that even low concentrations, very low concentrations, they are getting exposed to milligrams from the environment, but even low concentrations of the lead can play an important role in creating the toxicity, so therefore it is neurotoxic. And so you can see the amyloid peptides, we can't take the brain and test in the laboratory. Therefore, there are similarity in situation in the laboratory by taking the amyloid peptides 140, AB140 and AB2535, like AB140 and AB2535, we prepare different concentrations as exposed to the brain cells and see whether it is going to have a toxic effect. Yes, these two are 2535 and 140 amyloid peptides causing toxicity to the brain. We can easily see here at by 8 micromoles and 60 micromoles levels. So lead is causing neurotoxicity and is neurotoxicant, and amyloid peptides AB140 and 2535 is also causing toxicity. And these two in combination, how it is going to show effects on the brain, we have started testing it. And you can see here 25-35 low concentrations, how it shows the effect, and even 140, 120 micromoles, how it shows the effect. Yes, it is showing a 60 micromoles, 80 micromoles is having different time intervals, is showing different toxicities. And you see the broad range of the cell viability we have checked by using MPT assay, and we see that 140, 25, 35 and lead all are causing toxicity, and the cell viability is going down, the brain cell death is happening. And you can see these are the pictures which we have taken in the laboratory, our own cells. You can see control cells having normal connections here, and with lead, this losing of the connections, loss of connection, cells become circular and decrease the cell number. You can see the cell number and loss of immunities, and also cell lysis happens. So therefore it indicates that the lead and amyloid peptides are toxicants to the brain and neuronal cells exclusively. These are the pictures which we have taken from our laboratory. We are considering the neuronal cells. And you can see the scanning electron microscopy data, where the doubling, you can see the doubling and also the membrane protrusions and disconnections between the cells. You can see the disconnections here, and also loss of texture. You can see the loss of texture and cell lysis. This is being confirmed from the laboratory through the scanning electron microscopy data also, the normal morphology. And you can see the pH stain. Propionimidate is a versatile dye for the dead cells. Once we put the propionimidate under the cells, how many cells get dead? We can easily assess by using pH. So therefore, we have tested with this also. We can see easily here. When we expose lead and amyloid peptides together in combinations, more cell death has been happening. That means it is definitely a toxicant, it is said to be a toxicant. And cytotoxicity, which is in a broader range, previously we did in a broader range, here again we did in the narrow range in micromoles, starting with the very low concentration, shows that still toxicity exists. And oxidative stress parameters, because it is causes oxidative stress also. And what kind of parameters, reactive oxygen species, glutathione and T-bars, we have tested out in the laboratory and say that These are all causing oxidative reactive oxygen species are more being generated. It is causing toxicity to the neuronal cells. And you can see the total antioxidant activity, glutamate estimation, all these things clearly indicates that it is causing oxidative stress. Increasing levels clearly indicates that the cells are undergoing death through the oxidative stress process. And even DNA oxidative damage and protein carbonylation also were tested. You can see here more of protein carbonylation through the nanomoles per ml. More of protein carbonylation means it is undergoing oxidative stress. And you can see, we further want to see the inflammatory mechanism, how it causes the inflammation through the different pathways. These are all the words which I am going to speak in coming slides. NF-kappa B signaling pathway, NF-kappa B, PNF, 1K beta alpha, all these things I am going to speak in coming slides. These are having different kinds of functions. You are controlling and you are making more of information. You can see the pro-inflammatory pathways like M1 and anti-inflammatory pathways M2. We have to target more of anti-inflammatory mechanism. If you any kind of oxygen causing M1 polarization, increasing that parameters means it is causing more of inflammation. Any agent which reduces the markers towards the M1 polarization shows that this has got effect on the anti-inflammatory mechanism. So those things also will be tested in the laboratory. And M1 markers and M2 markers, these are all the markers. The M1 markers are pro-inflammatory, M2 markers are the anti-inflammatory. And see, you see the NF-kappa signaling pathway where it is more towards the M1 polarization. You can see the levels have been altered here with the addition of the rosemary acid, how it is going to have effect. See, because the NF-kappa and the NF-kappa are being decreased, the exposure of the rosemary acid indicating that it can act as an anti-inflammatory agent. You can see ISACPR P63 signaling where these kind of things also, this must be decreased. When we add rosemary acid, these levels have been gone up, means it is showing anti-inflammatory effect. Rosemary acid is a very effective anti-inflammatory agent. And here, these cytokines, like cytokines like TNF alpha, IL gamma, IL6, these are all cytokines which plays an important role in the inflammation process. And the TNF alpha, when amyloid peptides exposed to the glial cells, and the elevated levels indicate that it causes more of inflammation. So that when you put the rosemary acid and the levels have been going down, so that means this kind of anti-inflammatory mechanism is showing. Like, for example, you can see the IL-10 and IL-4, these levels have been declined at the beginning, and when rosemary acid is being given, they try to protect the cells. So therefore the levels goes up. So here, they at the beginning very low. When rosemary acid is added, the levels goes up, means it is protecting the brain cells. So the microglial cell markers like M1 markers like COX2 and INOs, in the beginning I have shown these two are important markers which levels, altering the levels also show that they have going towards the M1 polarization. Therefore, indicates that it is showing a kind of toxicity. And the M2 markers levels goes down, means this rosemary acid plays an important role in reducing the inflammation, like the markers like CD206 and RB12. And neuronal cell death analysis we have seen with the microglial and the co-culture studies also we did in the laboratory. The neuronal cells and microglial cells, these two have a different kind of function here. And you can see this one is the post-cytometric data where it indicates that these co-culture, the co-culture in the laboratory shows that it has got a protective mechanism. So these are all live cells and apoptotic cells, and when you expose the rosemary acid, the necrotic cells and the apoptotic cells levels have been going down, means it shows a kind of protective mechanism. And the microglial cells, that was about the neuronal cells, and we did microglial studies also. Same kind of studies we have performed, like ROS and total antioxidant activity, glutamate levels, calcium levels, and DNA oxidative damage and protein carbonylation with the microglial study, that was neuronal study, where you can see the levels going down and showing that it has got more of anti-inflammatory mechanism. which shows that these levels have been going up, which is showing more protective mechanism. And again, we did the co-culture studies with the HMCT cells and the model and microglial cells, which we did the rosemary test addition because this one neuronal cells are ISACPR cells, and this combination with the rosemary test shows that it has got a protective mechanism. Similarly, here also we have seen the M2 polarization is getting more towards anti-inflammatory mechanism, and this rosemary test plays an important role in reducing the toxicity. So, if you see all whatever the study shown till now, it shows that this slide clearly says that peptides led shows the reduced viability and improved survival rate, and when you add the oxidative stress parameters like ROS, protein organization, and de-oxidation is increased, with the addition of the rosemaric acid, the MF polarization is going down, showing that it is reducing the inflammation, and the M2 polarization is going up, and it is increasing the anti-inflammatory mechanisms. So when rosemaric acid is being added to the cell, the reduction is cell death also. Here you can see. And the neuronal cell death and microglial cell death have been reduced means it has got some kind of productive mechanism. Thank you very much. Any doubts?
Now the session is open for questions. Any questions from the audience?
Hope you have not understood what was for. It's a very advanced work which we did in our
The work is very elaborate and currently deep and shows the interrelationship of our food to the disease mitigation, and they highlighted the compound which is very widely available in our food material, and also the source of toxicity is also very widely exposed. So how we integrate our food material to mitigate the disease progression is very well explained scientifically. This proves that our ancient Ayurveda are foods with the foods itself openly balance our good health. And we thank Suresh sir for his extensive collaborative work and proving that again Ayurvedic treatments which has no scientific value can be given scientifically proven for the acceptance into the modern medicine and cure the long-term diseases. Someone from, please come here.
Hello, sir. Sir, can you please discuss about cell cultures, specific cell cultures replaced in this process, and exactly what are the currently available natural alternatives along with pattern and signaling mechanisms, and potential of cannabis in maybe in solutions and what is the possible mechanisms secondary. And currently what is happening, sir, is recently the cell culture studies are going in India. We are yet to update those things. Can you please guide us?
See, this is a very complicated work which we have to design in the laboratory first. And what I was doing in the beginning is with the neuronal cells. Like we have a model, a human neuroblastoma cell lines, like SHS5 model is there, which is readily available. If you want, I can provide a file which is there in our laboratory. We work on a day-to-day basis. And that is a model of the neuronal cells. Whatever the agent you want to study for the toxic testing, we can do it in the laboratory and we can just expose the toxic material and we can check for different parameters like oxidative stress parameters, inflammatory parameters, apoptosis, everything you can test. Only thing is you have to design what kind of concentration you want to get exposed. For that you need to do a little baseline study and establish what kind of toxic concentrations are you are intended to get exposed to cells. That is first point. The second point is when you go for the implementary studies, here in this study there are two cells, two different kinds of cells are there. Microglial cells and the neuronal cells. HMC3 is microglial cells, which is available in normal cells. You can culture them in the laboratory also, you can see. And when you are studying implementary or oxidative stress or apoptosis, we have to identify the markers in the beginning itself. What kind of markers you can pick up? If you study those markers, what kind of results you can expect? You should be able to predict in the beginning itself. And because these are very costly antibodies and all, so some of the data that I was showing is that post-elementary data also, the advanced equipment also. Easily we can, with a 10,000, 15,000 rupees antibody, we can generate a very good data in post-elementary also. And also, morphology you have to see that. In the beginning itself, we have to check for the morphology. We have scanning and microscopy in the issue. So, want to utilize our services also can use. We have confocal imaging also. You can just put the cells, cell growth also you can monitor on a real-time basis in the confocal imaging. Those things we can do. You can't say that this is good for that, that is good for that. Without doing the perform in the laboratory, you have to identify yourself before going to the next step. You can't design the work and do that one from the beginning itself. While doing itself, you can design the work based on the results what you are getting. And regarding the nutraceuticals, you were asking nutraceuticals, yes, there are hundreds of nutraceuticals available. But which one is edible, which is locally available, surrounded by us? For example, rosmarinic acid is available with us. Nobody knows about that. And it's a very highly ignored compound. It has got a very big effect like other things also, not only neuronal things, but it has got an antioxidant, it's basically anti-diabetic, anti-hypertensive, anti-cholesterol. But apart from that, I wanted to study using neuronal use also, whether it has got a protective mechanism. I really found that this is having some kind of effect. We did both in vitro. This is in vitro data. We have studied in vitro, in vivo models also, animal models also. We did that studies. But you have to be very choosy in getting the chemical solubility also. Solubility is an important factor. It is water soluble. It pushes the media, it has to go into the cells. So that it exhibits a kind of effect, it has to go into the cell. Otherwise, it is not possible. This is not dissolved in the media what you are using. So that your experiment will go waste. So those kind of things initially you have to do a kind of basic study. Then only you can go ahead. Thank you so much. Anything else? Thank you very much for giving me a
marketing product available on Rosemary Acid? Product. Marketing.
See, marketed products and hundreds of marketed products are there. Ayurveda products are there. But Ayurveda products itself includes like mercury. Mercury will be there within that. It causes toxicity. But in the lower levels, it won't cause toxicity. We have not tested any marketed products till now. We have isolated things only in the specific area we are interested. We have picked up different life. We tested estradiol, we tested epigallocatechin, which is gallate. It is a tea catechin. What in the green tea is there? EGCG, epigallocatechin gallate. We developed, produced more than 15 publications in that area. My student is at US, University of North Carolina right now. So this work did by Mr. Lokesh, he is at University of Nebraska right now. And other students Thank you.
Good afternoon, sir. Sir, yeah, I'm a professor here in Valedictory Institute of Pharmaceutical Sciences. I'm Dr. Valedictory. Sir, I wanted to know regarding anti-migraine drugs. Migraine. So you have told a lot about neuronal cells and all. So what is the possibility we can test migraine in vivo if you want to study?
Migraine, we basically not studying the immune system. We have animal models. We can induce migraine and we can study in animals basically. Till now, I have not come across any kind of in vitro model which we can really, because if we want to study any kind of model, we have to induce that model in the beginning. Here in this case, we have simulated the Alzheimer's situation here by taking amyloid peptides, because they are very prominent amyloid peptides like the amyloid A-beta 140, A-beta 2535 is, you can see more in the brain. In the Alzheimer's patient, these is deposited so that we have given later amyloid peptides together and to the cells and we have tested the consequences. But in migraine, there is no such kind of model is available right now. But it's a really good one. It's like it, but not to repeat it.
Because actually in my doctoral thesis, I have done only pharmacokinetic evaluation.
That's what I'm telling you. You don't have any model for migraine. Because migraine is not a continuous process. It comes and goes. Therefore, we can't simulate the situation by assessing in animals. Alzheimer's is a continuous process. Once it comes, it will be very poor, so that we can simulate and study, thinking that this is a human model only. But in migraine, really I don't know. Let me look at that.
So thank you so much.
So that calls for a huge round of applause for this wonderful session. Once again, thank you, sir, for giving this session and sharing the same. I request you to please take your seat off the dais.
Thank you all.
regarding which
May I request our Honorable Dean Sir and Dr. K. Rao also to please come onto the dais. I request our Dean Sir to felicitate Dr. Chella Suresh Garu. Round of applause, everyone, please. Thank you so once again for accepting our invitation. I request our organizing secretary, Dr. Teja Kumar, also to please join on the dais. Dear audience, please give us a good round of applause. Thank you, sir. Thank you, everyone. So without delaying much, as we have more sessions for the day, let's dive into the second session of the day. It's a pride for me to introduce our next speaker, Dr. M.B. Narendra Kumar Taluri Garu, who's a distinguished expert in pharmaceutical analysis and viral technologies, currently serving as Director, ARD Knowledge Management and Technical Support, SEA at Diocese Viral Technology India, and Honorary Secretary of the Royal Society of Chemistry. With a PhD from CSIR, Indian Institute of Chemical Technology, Hyderabad, Dr. Taluri Garu has built an impactful career spanning academia and industry, including leadership roles at NIPER and Biocon Bangalore. He's authored over 90 scientific publications with multiple papers recognized among Science Direct top 25 hottest articles, and a 2023 publication named a top downloaded research article. As a dedicated mentor, he has guided 50 plus MS and 4 PhD scholars, many of whom now hold leadership roles in global pharmaceutical companies. Dr. Taluri Garu's contributions have been recognized with several prestigious awards, including the Young Pharmaceutical Analyst Award 2011, Best Research Scientist Award, NIPER 2016, Diocese Diamond Innovation Award 2023. He is also an Associate Fellow of the Telangana and AP Academy of Sciences, an active member of leading scientific bodies such as the Royal Society of Chemistry, London, and the Asian Council of Science Editors. He has served as a reviewer for numerous high-impact international journals, including Scientific Reports and the Journal of Pharmaceutical and Biomedical Analysis. He is also a trained GLP inspector under the Government of India and contributes as an examiner for national level scientific and academic evaluations. May I request our Honorable Dean, sir, to please come onto the dais and heartily welcome the speaker of the second session, Dr. M.B. Narendra Kumar Taluri Garu, to please come onto the dais. Round of applause, everyone. Hearty welcome to you, sir.
Now I would like to take the pleasure of inviting today's chair, Dr. Mohammad Abdul Hadi is a distinguished academician, researcher and administrator in the field of pharmaceutical sciences. With over 15 years of teaching, research and academic leadership experience. He is currently serving as Professor and Head of the Department of Pharmaceutics as well as Training and Placement Officer at Boston Pharmacy College, Hyderabad. His research expertise encompasses novel drug delivery systems, chronotherapeutic formulations, pharmacokinetics, bioavailability, and biostatistics. He has made substantial contributions to pharmaceutical research, publishing over 60 research papers in reputed national and international journals with over 500 citations and a H index of 12. He has also authored 7 books, 1 book chapter, holds 1 patent and has research innovation, student mentorship and institutional growth. His contributions continue to inspire students, researchers and fellow academicians in the pursuit of excellence
I request our Dean Sir to please come onto the dais and welcome the chairperson of the session. Hearty welcome to you, sir. Thank you, sir. So over to Dr. Neurotoxicity, sir, for the session.
Good afternoon. Audible? Good afternoon. Thank you for the invitation. I'm happy to see good number of pharmacy students. Can you come forward if possible? Yes? Okay. So my topic is totally related to the analytical technologies, right? So I'll try to give some brief about the different analytical technologies used in pharmaceutical industry. The title is like this: recent advances in the chromatography and application in pharmaceuticals and drug technologies. So majorly, what is major analytical technique commonly used in pharmaceutical industry? What is commonly used analytical technique in pharmaceutical industry? Can I get answers? Yes or no? Can I get some answers? HPLC is the analytical technique very commonly used. Yes or no? Yes? Is it audible? Yes or no? Yeah. Okay. So quality, safety and efficacy. Quality, safety and efficacy are the three important parameters in pharmaceutical industry. So once you have synthesized a drug, it may consist of some of the minor impurities, right? So these impurities must be less than 0.0%. Are we able to separate these impurities from the main drug and ensure that all these are non-toxic? This is one of the important activity in pharmaceutical industry. So monitoring and controlling of impurities is the major role in pharmaceutical industry to ensure quality of the product. Okay. So what is ISACPR? International Conference for Formulation or Technical Requirement of Registrations of Pharmaceuticals for Human Use, right? So as for ICH guidelines, there are good number of guidelines. One is quality guidelines, stability guidelines, analytical validation, GMP good manufacturing practices, analytical development guidelines, like this different guidelines are there. Once you go to the impurities, Q3A, Q3B, Q3C, Q3D, based on organic impurities or inorganic impurities or residual solvents or metallic impurities, you are classified as A, B, C, D, Q3 guidelines. So we are using small quantity of metals like lead, cadmium, nickel during synthetic process of the that will become toxic. Or hydrogenations, nickel, cadmium, palladium, these type of metals is there. Minor quantity we can monitor. So these are metallic impurities. Which technique is very commonly used in case of metallic impurities in pharma? Metallic impurities. ICPMS, independent coupled plasma, mass spectrometry is the technique of choice for monitoring minute quantities, parts per million, parts per billion, or parts per trillion level of analysis is possible. So leftover minute quantity trace organic solvents, residual solvent analysis, gas chromatography, mass spectrometry, X-phase gas chromatography is the technique of choice for minute quantities of residual solvent analysis. Okay. So, like that, good number of quality guidelines are there. So, based on the quantity, what we are going to take, there are already specifications said less than 2 grams per day daily dose. So 0.0% impurity is required in reporting threshold. So if it is 0.0%, you should report to the regulatory agency and you say that this is the percentage available. So it may be not identified. If it is 0.1%, you need to identify it by using suitable analytical techniques like IR or mass and all. So once you tested it, there is no toxicity. So you can allow that impurity maximum of 0.15%. So these guidelines are already set based on doses. Is it less than 2 grams or more than 2 grams per day intake by the patients? So ISACPR in 1995 released the guidelines. Analytical measures which are able to, if you are able to do resolution must also spike no concentration without having interference in the excipients. You should get nearly 100%. That is the recovery standard. So all these parameters need to be done once you are done suitable for the master files of patients. So industry is analysis and submit for the master files. So how these impurities coming into the final drug substance forwarded towards final drug substance. That is the major reason that we do these impurities. Products of incomplete reactions. Reactions not because of the reaction conditions, say high temperature conditions or so. Next one is for the solvents what we are going to use as part of synthetic reaction. That is exposed to different atmospheric conditions, degradation works, anisomeric impurities. We try to see some about anisomeric impurities out of monitor and residual solvent, inorganic impurities, and even excipients which carry some of the impurities. Two, enter this technology is smart analytical chemistry or smart pharmaceutical analysis. What is smart? In case of this smart, one is, so we are having now the approach to integrate advanced technologies such as artificial intelligence, data analytics, and green and sustainable principles to get the better results. So there are 4 pillars. One is green analytical chemistry. We are using all reagents which are environmental friendly. Sustainable analytical chemistry. Industry is supposed to use it for a longer time analytical chemistry. So in case of green, low waste, energy efficiency, eco-friendly reagents we are using. So that is green. And white analytical chemistry is cost effective, time efficient, and operational simplicity with good precision and accuracy. Sustainable one is renewable resources. It is more industry friendly in doing the things. So if you are incorporating AI technology, so instead of taking large data, the final data which is really having some impact, you are considering that. And of course, some adaptable chemistry and some innovation. All this together, we can make this a smart analytics. So 4 pillars: green energy chemistry, sustainable and white energy chemistry, and artificial intelligence. So red means regulatory. Always they ask this, so many things. You should have good limit of detection, limit of quantification, good precision, accuracy. You should follow all these regulatory principles. That is red and color. So blue is the one which is industry friendly, sustainable, cost efficiency, time efficiency, and operational simplicity. I can transfer whether from the area to the production section easily. All these are blue principles. So green, we are in more environmental. So all this meeting today, you are enacting nowadays artificial intelligence to handle smart. So the concept of QPD, quality by design, is there from 2002 in industry, but majorly into the production, especially information development. So it is slowly coming towards analytical method development also, because finally we are submitting analytical data to the regulatory agencies. So a systematic approach to pharmaceutical development starting with predefined objectives on product and process understanding methods. So process understanding is not only the product development or process development. We are now analytical development also. We are incorporating QPD, quality by design concept, to have efficient methodology which can be easily given to the regulatory agency, flexible analytical conditions. So once one more additional impurity observed in one of the processes, we should not go back and do validation again. So once you have the flexibility, that is the major initiative. So as per the analyst point of view, analytical development is like this. We should have an accurate method, that is most important. And of course, analysts always asking for rapid method, short runtime, good precision, repeatable results, and of course, robust methodology. So small deliberative variations which are happening in the lab should not affect your method. So like that, you should have all these points in the mind once you are developing analytical methodologies. So many things you are doing exercise, pH changes, grading changes, flow changes. So interaction of all these variables together give a systematic design space. Once you have that design space, you can be able to use that design space without changing every time methodology and do validation again. So variables like pH, temperature, gradient programming, and what is the variability of the area and retention time. So all these are like parameters. So you can see the process controls of analytical development. We try to see with an example how this will influence for the development of QPD concept. So we are taking one example known as the receptor and its impurities. The receptor is present. So on this pharmacokinetics, and there are 6 impurities out there. The receptor. So now the HPLC system was considered as water system, which is commonly available in many labs. Now 4 different chemistries, columns, C18, C8, phenyl, and used core technology. C18 is very commonly used, very well known. C8 is less hydrophobic. You can reduce the runtime, that is the intention between the C8. Phenyl column because aromatically the molecules also consist of a number of aromatic groups, so 5p interactions. So that and in addition to that, the success rate is very common with the C18. Most of the methods are developed on that. We are using fused core shell technology, which is giving UPLC performance in HPLC. So that's the reason we can select 4 different columns here. So of course, design expert software to implement the QPD concept. So coming to the QPD, there are 3 important parts here. One is ATP. What is ATP? Analytical target profile. So accuracy should be accurate. The result cost less than 10 minutes is expectation, and more than 2 resolution is the expected resolution because we are implementing QPD. So 6 compounds, 6 impurities plus 1 drug, total 7 compounds operation with resolution of more than 2. Generally, HPLC requires 20 minutes of runtime. So, and critical quality attributes are like what is the resolution between the 2 peaks, and what is the retention of the peak, which is emitted very late. So, the last emission peak is important. It is immediately gradient emission or beyond that. So, and peak shape of the last peak is also important. And what are the risk parameters? So risk parameters are like the column what you are using, and if you change the column from C8 to C8, different injection times or resolution changes. pH of the bubble phase 3 or 3.5 or 5, so that is also there. And temperature, argon, molecular, and flow rate. So all these are risk parameters. If you change something in this parameter, definitely that will affect the change in the resolution, retention, and pitch. So these are the different parts of the PPT concept. To implement this, we take in two different phases. One is screening phase, another one is optimization phase. In screening phase, how we go for two pHs, one is 3 and the second one is 5.5, and third one is organic molecule, either methanol or acetate. So you see these are how many variables? 1, 2, 3, 4, 5, 6, 7, 8 different conditions we are doing to the development of a method. So how many experiments we need to do? Each one column, one pH, another one organic solvent. Like that, if you calculate good number of exercises, you will do it. But design expert is trying to give you only 16 experiments to fulfill the requirement of all the interactions possible, all the possible best possibility from all these combinations. So that is phase 1. Once you are getting results from that 16 experiments, you are implementing the optimization phase. So one is like you are changing temperature, gradient, and flow rate. These like again 8 experiments you are conducting. So from that totally you are getting activity counts. You will see that. So initially design experts suggested 16 experiments. 5.5 pH, isolated phenyl column, say 5.5 isolated C18 column, 3 methanol C18. Like that, there are like 16 experiments, and we are expecting maximum one time of 20 minutes. So here, based on the strength of the organic solvent, whether methanol or acetate, we are giving gradient, which is called linear gradient. Starting with slow to the highest strength, we are increasing, say 5% to the 80%, or 10% to the 100%. So based on the strength of the organic solvent, generally estimated is more strength compared to the methanol. That's the reason. So 80%, 5 to 80% is starting range. Here methanol is 10 to 100%. Expected is total 20 minutes. Let it go. So see how best results are made. So once you completed all the 16 experiments, overnight you can complete it and get the results. And these are the resolution parameters and total runtime here. You see the resolutions are good. So you see the less runtime, for example, 8.84. This 1.44 is less than 2 resolution. So we are avoiding this, even runtime is less. Next best possible runtime is 9.75. Here, these 5 and 6, like the peaks are not yet separated, they are not resolved. And the next best possibility is 10.41. Here, all are get resolved. So minimum resolution is 3.21. It is coming within 10.41 minute. This is screening phase. Then we optimize it further. So because optimization parameters are also there. So we are starting experiment number 13. Within 10.41 minutes. Then go for the next level for the So again, we are taking the help of design expert. Flow rate, column temperature, and total runtime. These are 3 variables. So total 8 experiments. 1 ml flow rate or 1.5 ml flow rate. 30 degrees, 50 degrees, maximum temperature of 50 degrees. And flow rate means runtime is 7 minutes or 10 minutes. So we've got 8 experiments to cover the entire range. So these are the results of the HPLC separations. Yes. So from this we are getting some graphs. How these are affected. So 30 degrees, 35 degrees, 40 degrees, like 50 degrees. Temperature, this is flow rate. How the resolution is affected. By increasing the flow rate, the resolution is coming down. Okay? And the flow rate versus runtime, how it is changing. The temperature versus total runtime, how it is changing. The flow rate, which is pH, how it is, resolution is changing. And temperature versus pH condition, how it is changing. All these are predicted models from the design experts, how it can be influenced. So we are not doing the real experiments there. But finally we are validating it. We are verifying some of the parameters and trying to concluding that these experiments are correct. So from this data, pH 3 to 3.3 is a flexibility for the methodology, and 50 to 65% within 7 minutes runtime is okay. You can extend up to 10 minutes also, there is no issue. And 1 ml flow rate or 1.3 ml flow rate is also fine. There is no effect in the results. So like this, these are the flexible results we are getting from the UPD concept, qualification concept. So this is the final turnaround we are getting. There is a peak-to-peak separation very good. There is no any issues. This is all coming within 6 minutes, less than 5.6 is the last RT of the minute. So for all this, 7 peaks are getting evaluated within 6 minutes of time with required resolution and good peak shapes. So once you are saying these are the flexibility results, is it really working or not? We need to verify it. This design expert says this. These are like a range of conditions you can apply. But so randomly set 5 different experiments. First experiment started with flow rate of 1 ml, 30 degrees temperature, pH 3.2. The second one is 1.2 ml per minute flow, temperature 30 degrees, pH 3. And third experiment 3.3 pH, but temperature is 30 degrees. Like that, randomly we select different conditions, either temperature, flow rate, or pH, to see how these results are given. So you can see here all the drug components, either drug or drug impurities. You see the accuracy, all are near to 100% in all these conditions. So it means that it is working perfectly good within that. Once you give this to the regulatory agency, for example, for research, if something new impurity comes into your process or the regulatory product comes, so again there is no validation if it is anything within that for the one time, because you have already checked it is within the limits. It is validated, not only validated, it is verified by the UPD concept. So that is the use of UPD concept to implement. So these are the different 5 different experiments what we verified. All these are looking fine. So these are applied to the different bulk drugs. So the impurities in recommended quantity observed even for the tablets, and later it was implemented for the LCMS study to characterize these impurities. So we find the identification perfectly as per the structure expected. So that is about the UPD concept of implementing in the stability studies. Also we can incorporate this UPD concept. So I'm able to get something out of this. So now coming to the additional impurities. As we mentioned that impurities are different categories: organic impurities, inorganic impurities, residual solvents. So in the organic impurities category, additional impurities will also play a role. We know Talgate case. So if one is left hand, another is right hand, it looks similar. But activity wise, one is therapeutically active, another is toxic in nature. So try to minimize these anisotrophic impurities in blood, minute or less than 0.0% to minimize its toxicity. So for that we are using this parallel HPLC. The column is different for the HPLC to separate anisotrophic impurities. So all you know that this is HPLC. Just I am showing here quantitative HPLC to get the information very easily. So these are pumps, right? This is injector, manual injector. This is auto-sampler injector. This is photodiode injector. So these are like motor phase reservoirs. You can use it. So this is analytical column. This is preparative column. Load the more quantity and the purification of the sample is possible by preparative HPLC. Of course, you need to use preparative HPLC for preparative purification purpose. Of course, this is from around. This is manual You're removing this and keeping HPLC column there. So this is basic equipment. What is this? This is SFC. What are the form of SFC? Supercritical fluid chromatography. Here you are using CO2 as a mobile phase instead of water or X-ray solvent. You are using CO2 to the required temperature and pressure. So it will be as supercritical fluid. It will be able to dissolve the samples very easily compared to the where there is no possibility of dissolving it in water or X-ray type of analysis. So especially purification of natural products, supercritical fluid is one of the important complex condition. So you may be having one more additional pump to flush the CO2, supercritical CO2. So that is the supercritical fluid chromatography. Once you are condensing the gas CO2 and compressing it and heating it, that will become supercritical fluid. That will be introduced to the top of the column and trying to interact with the stationary phase as well as analyte and getting eluted out one after another. Once that work is completed, it is again coming back to the cylinder. So decompressed and going back to the cylinder. So that the reason this is known as green analytical technology. The CO2 what we are going to use at high temperature and pressure going back to the cylinder. So recycling processes happen. That is green analytical technology, which is also one of the important technology in industry, especially for integrated purification of large number of biomolecules, natural products, peptides, even small drug molecules. The solvents like X-rays and so you are introducing CO2 to purify the samples. So what you are getting separation or not having separation, you may get good separation here. Faster separation, the lower it is 3 to 5. You can get a shorter time and better resolution for the SFC compared to the HPLC. And the big data. Isolated control, fractions are corrected. In case of water, you need to do regularization, right? In case of X-ray and other things, you have to do the rotor operations. So large quantity of organic solvent you are using here. But here, the CO2 is still going back. 70% is removed. Only remaining 30% like ethanol, small organic solvents, you can evaporate the rotor operation. So in that way, consumption of the organic solvents are less here. So this is green technology. So either HPLC or SFC, especially in case of chromatography, we are using different stationary phases. Polysaccharide based stationary phases. Generally particle size 20 microns is for the preparative purification purpose, 10 microns is for the generally semi-preparative, 5 microns, 3 microns are analytical purpose. If it is sub 2 microns, less than 2 microns, say 1.7 or 1.8 microns, UPLC. Okay. So either HPLC or SFC, these are the stationary phases in case of. So iron chromatography is not only polysaccharide based, other stationary phases are also there. So Becquerel type, macrocyclic, cyclodistance, macropeptides, Brownian, Swallen X-rays, protein type. So these are the different category of characteristics available in the market. Out of that, you see the loading capacity. Which one is having more loading capacity? Which one is having more loading capacity? Polysaccharide based derivatives. 5 to 150 milligrams per 1 gram of stationary phase is widely intended. So, loading capacity is more means it is easily useful for the preparative purification purpose. That is the reason in chiral HPLC, especially preparative mode, you need to opt this polysaccharide derivatives as the choice for preparative purifications. So what are the interactions? How is the chiral recognition happening? So this is phenyl carbamate, which is attached to the either amylose or cellulose derivatives, or amylose or cellulose. So phenyl carbamate having these electrons having pi interactions, hydrogen bonding, again hydrogen bonding with this, and hyperdental interactions. All this cumulative effect of all these interactions will influence one of the enantiomer stays with the chiral stationary phase more compared to another connection law. So that the reason resolution is happening here. So amylose and cellulose. Try to see what are the trade names or markedly available some of the stationary phase acetylcyclic columns. Polysaccharide stationary phase is one of amylose or cellulose. So 3,5-diphenyl carbonate that is available in market as current IA. Same 3,5-diphenyl carbonate attached to cellulose is known as current IB. IA is amylose, IB is cellulose. So 3,5-dichloro phenyl carbonate, cellulose attached to IC, monochloro, trichloro, that is ID. 3,5-dichloro, amylose attached to ID. So like that, different namings are given based on the substitution of the phenyl group. So once you have substitution in the chlorine and methyl group in different positions, this selectivity, interaction with sensitivity, parallel condition varies. That's the reason we are producing more number of parallel stationary phases in market to have better selectivity for the wide variety of samples. So 3,4,5 carbonate is IG. So our cellular version is IK. So both are same, but one is attached to the amylose, other is attached to the cellulose. So because each one having different selectivity. So those are the different stationary phases of columns available in market for the separation of parallel compounds. Amylose base and cellulose base. These are trade names. IE, IPS are the trade names. But what is the chemistry behind this is phenyl carbonate or benzyl carbonates are there. Methyl benzoate. So these are some of the chemistries based on substitution of phenyl group. You are having different things. So in case of HPLC, there are two modes of operation very commonly used. One is normal phase, another one is reverse phase. No interaction, only on-site. One is normal phase, another one is reverse phase. So here also normal phase, reverse phase. In addition to that, PO mode, polar organic mode, polar compounds we are using mobile phase. Instrument methanol, isopropyl alcohol. So these are the polar organic solvents. In reverse phase, water with buffer, either with acetonate or methanol with combination. You can use some normal phase. Hexane, methyl estate, or alcohols you can use in normal phase. Healing mode is polar organic solvents only, but you are adding some quantity of water, say 5% or 10%, to make it flexible, to ionize in case of LCAS operation. So healing mode of operations and SFC, supercritical purity, what we just discussed, CO2 portion is around 60-70%, remaining is again organic solvent like alcohols, either ethanol or methanol, or isopropyl or acetonate. So how you start the analysis? Based on the solubility of the sample. The sample has solubility in hexane, opt for the normal phase mode. If sample is soluble in water, opt for the reverse phase mode. If sample is solubilized in case of non-standard solvent like methyl estate and MTB, methyl butyl ether, you can use non-standard normal phase. This is introduced for the parallel separations, especially if you want to use these solvents in equilibrium versions. These stationary phases are two categories. One is coated version columns, the second one is immobilized version columns. Immobilized version columns are suitable for all the operations, including reverse phase as well as non-standard normal phase. So like that, we can have this information. So I think these are little bit. So these are like coated columns, AD, amylose based. These are cellulose based. So these are reverse phase dedicated, and these are immobilized versions. You can use either reverse phase, normal phase, or polar organic mode, or non-standard. So there are like two particle size is very commonly used. One is 5 microns, another is 3 microns. Small size particle size columns are generally having more surface area, more interaction with the relays. The reason the efficiency will be more for the 60 to 40% efficiency will be there for the less particle size columns. So we are using these sub 2 microns, UPLC, especially the chiral. Because the polysaccharide layers will not be more lactose like silica-based columns or CED columns. So in that case, you can use good chlorate. So you can see the separation of the enantiomers happening in seconds. Less than 1 minute you can able to separate these enantiomers by using less particle size columns. So it is more saving your time. Overnight you can do the good number of analysis. So if it is R&D work, you want to use good number of screening protocols and get the results ready by morning, you can use a sub 2 micron particle size stationary phase, aero stationary phase, you can use it so that the reason you will get the shorter runtime and better resolution. So like that you can see here, it can be available and you will see here. These are the, you can load your sample here. Even you can prepare your stationary phase means column. All the columns are there, tag the beginning there. So for the preparatory purifications, like gram level purifications, you can do here. So for the clinical applications, some of these synthetic process of drug may not give the total chiral relation. You need to remove some of the chiral impurities during the final step of the drug. So in that case, simulated movement chromatography, SME, they call as SME, where all the columns will be serially connected, 8 columns for example. So one after another, it is exposed to this sample and get interacted with that and separation is happening there. That is known as continuous movement chromatography. So after current extraction methodology, simulated here, so that it is even SME, simulated movement chromatography. That is also possible. So as I mentioned, like 3-chloro-5-methyl propionate is one of the other stationary phase, which is separated from the previously imported version columns like ED and other columns are need to be used. So once I take this imported version columns there, then we are directly using this. Again, where are we going? Here we call previously, now imported version. Imported version is you can use all modes of operation, the reverse phase, gamma phase, power organ mode or assembly mode, SFC mode. Again, one more example. This is also gets separated. Previously, OJ column, again, it is quarter version column. You need to be extremely careful to use that column. You can't use the reverse phase condition there. So, our non-standard gamma phase condition can't use it in case of OJ. But, immovable ICS columns, immovable version columns are suitable. There is second. In case of this methyl benzoate aromatic. So methyl benzoate aromatic is known as LH. This is also had good applications like pharmaceutical steels. Previously body, cyphenamide, roxamine. So all 3 isomers along with the APA get separated. Physical so cis-trans as well as chiral impurities get separated. Quote-unquote inhibitors, all these are separated by using the IH column, which is again immovable version column. IJ is also replaced to the OJ. So you can see here, this is simple hexane and the propanol, normal phase. This is water estimated condition, reverse phase. This is hexane ethanol with more separation, suitable for preparative. So analytical, preparative, bioanalytical. You can count any mode of operations because these are high series, immovable version series where parallel separations are possible with all modes of separations. To get some basics. This is there in this pharmaceutical here. So both HPLC and research information is there. Freely available, you can download. This is the article published on the chromatography separations and its anisotrophic impurities. So in general pharmaceutical analysis, this is one of the top 25 hottest articles in general. So the screening protocol and how they will be helpful for the separation of the chromatography. So just I want to give 5 more minutes of time to say about amino acid separations. Nowadays, peptide catalytics are coming into the market in larger extent. So in that case, even this anisotrophic separation is possible here. We need to see the 21 natural amino acid separations, but there is no single solution to separate all these 20 natural amino acid separations by a single drug. But we recently introduced the column known as last column and diazine. So for this separation. So I'm not giving the whole introduction. These are like non-polar amino acids. Lysine, alanine, leucine, all this. The 4 aromatic, that is the 3 aromatic amino acids. Polar are like 5 amino acids which are having hydrogen bonding and kinetic activity, disulfide bond combination possibility. So positively charged are 2 amino acids. Total 20 amino acids. Can we separate all the 20 amino acids in a single one? That is not possible. So because polarity is different, charge is different, structural diversity is there. So generally, derivative amino acids are not being able to separate in general. So we try to use this AQC reagent. It is not new. AQC reagent is commonly used for amino acids derivation because of good intensity peaks in case of DB detector and compatibility with the mass detector. So we opted that AQC reagent very commonly. What we prepared is this last model, which is ion exchange model. Majorly it is done in the Europe side and some applications developed in India side also. So to separate all these compounds in less than 5 minutes with the 21 amino acids. It is compatible with mass compatible mobile phase conditions, formic acid and ammonium format conditions. So DL anisomers will be separated and not take much of the time. So UV enhanced rating 254 nanometers compatible with this producing agent. No resonation happening. Mobile phase conditions are 10 millimolar formic acid and 10 millimolar ammonium format in estimated water, estimated 93 and water is 7%. The second mobile phase B is 50 millimolar formic acid and 50 millimolar ammonium format. In the methanol and estimated combination, here is 75 millimolar. 0.8 ml flow, it is UPLC methodology, so the flow rate is less than 1. And the temperature is also possible to extend up to 90 degrees, we are using 80 degrees, because the column capacity is having that capacity. So these are all like UPLC and with mass QD detector, which is a simple mass spectrometer. So, and these are graded profiles. So, start with 10%, increase to 100% within less than 6 minutes, and going back to 10%, then the grading profile used. So we can see here all these amino acids pairs get separated, individual pairs. So all these are related within 5 minutes, less than 5 minutes. So evolution order DL, except this protein, others are related DL. This is glycine is lateral, all are other pairs. So all these are resolutions between the peaks. Minimum is 2.4, the maximum is 11. Relative reduction times. So generally in pharma industry we use the FMOP production. So that is also tried in addition to the AQC derivation. So you can get the, because 2 different derivations gives the two different structures. You can able to see both the derivatives products here in a single one. So there is a protocol, derivation protocol. You can available that is there in the website also. You can use it and so how this gets affected both the hop and AQC single derivation one is here, except for one case. So COVID, the hop only required alternative column, that is 2DAX. Others are well separated in case of last column. So this is the protocol developed, this is protocol of peptide industries. You want to analyze all the amino acids in peptide panel. So initially FMOM derivation. Again, second step is reduced derivations of 3 impurities. So then you get the separation of all the 4 in a single protocol. Simultaneously you can quantify either impurities or not. So that is the mobile phase conditions was A and B, and so isotopic condition was used, and alternative one was used in mobile phase conditions. Right here, this is also published in the Chromatography open. So who was interested, you can download that article. So especially simple protocol was it is just 6 months old, there in the internet. Those are interested, they can start using it. Of course, you can start do the research work also on that problem because runtime is short. So all the natural evidence is accepted. So all these are advantages. Hydrophobic aromatic column testing and basic in a single way you can able to separate. And DL and both initial ones you can able to see. And we start using multiple columns and 2D-LC methodologies. 2D-LC methodologies. You can use this. So even branch chain amino acids like leucine and solution, all these are separated. Aromatic ones, yes, and this is an amide pairs, and chlorine, which is secondary, also separated. So this is good profile of amino acids in the peptide. So this is the one which was European Europe NASA, the major contributors of synthesizing that one. We just give some other applications. So NASA process is also maybe stereoisomer separation. 9 stereoisomers get separated and a single column. So that is about the Chromatography CRI. So this is all the 9 different stereoisomers. This is major D isomer, this is also question. So again we are doing some development and applications for this. Thank you very much.
The session is open for questions. Any questions from the audience?
My name is Dr. Swapna. So, Professor in Bangladesh, so why a pyranal chromatography? Why care about pyranal chromatography?
HPLC you are using for the mechanical scientist. For example, paracetamol is not a chiral, right? So compound is chiral in nature, having RNase, near L. Ordinary economic stationary basis, the CAD, 8 or 10, all these columns are not fit for the separation of these enantiomers, which are very close structure, right? Only spatial alignment is different from the atoms which are attached to the molecule. So in that case, the nature of the stationary phase is also should have some chirality. Then it can hold one of the enantiomer effectively, another enantiomer get resolved, so separation will be happening. So in that chiral stationary phases, we mentioned like 5 different peptide and polysaccharide phase, different phases are all very successful, available in market as a chiral stationary phase, as follows. We need to use these columns in place of C18 column or silver column. We use the same HPS as addition. Then we will get separation happening. So once you know that therapeutically one enantiomer is active, another one is toxic in nature. Thalidomide case is well known. How the newborn people depicted with the loss of legs or eyes or something because of toxic effect of one of the enantiomer. So the reason monitoring of chiral impurities is nowadays mandatory for the chiral drugs. So in that we are saying definitely there are good number of chiral chromatography methods are available. You can use GC also. GC indication is generally volatile samples, samples which are evaporated at stable high temperature only can use GC methods. Otherwise you need to derivatizing. In that case derivatization accuracy will be done. So underivatized methods are like HPLC methods very common or SFC. So mode of operation is also important, like normal phase operation, like exhaling alcohol or water with the reverse phase condition. In addition to that, SFC condition is also very successful in case of different methods. So chiral chromatography plays key role. HPLC, for example, industry HPLC plays dominant role, number wise. Again, in that specialized drug is chiral. Because chiral stationary phase are also very sensitive. We are not using properly, the stationary phase substance will come down. So that's the reason recently we just immobilized the version stationary phases. Total version is already there. AD, OD, OJ, these are the columns previously there. And then those are cellulose versions. Now they started using I series, immobilized version series, which are useful in reverse phase condition also. Flexibility to transfer from reverse phase to magnetics. Hope I have given some doubt.
Any primary composition for mass spectroscopy?
Primary composition.
For mass spectroscopy. Mass spectroscopy.
Difference in case of HPLC conditions what you are going to use. Say generally you want to use volatile wafers in case of mass. So in case of HPLC, for example, phosphate wafers are using potassium phosphate. In case of HPLC, those are not compatible with LCMS. So LCMS will highlight the molecule, but buffer also will be ionized. But phosphate wafer will not be ionized. It will be precipitated, new unnecessary noise. So it will damage the instrument. So in that case, if you have vision to develop the methodology for the mesh compatibility, go with the volatile wafers, ammonium acid, ammonium carbonate, perfluoroacetic acid, formic acid. These are the combinations. Phosphate buffers, citrate buffers, those are not compatible with HPLC, compatible with mass.
So what's one mistake that young researchers make while developing chiral methods, and how do we avoid it?
So you need to ask me what are the major mistakes done by you,
Yes.
especially in case of chiral. Chiral methods, the difference between the HPLC and chiral HPLC is the code. Okay. Say in case of capital operations, for example, C8 column is commonly used. Reverse phase conditions are very common to use. Means water will buffer the combination of accidental ammonia. We are using the same system. For example, coated color columns. They will damage your product because this water content will go and damage your stationary things if it is coated version. So washing the total instrument means remove the column, keep a union and flush with isopropyl alcohol. Isopropyl alcohol is an intermediate solvent which is useful to remove the trace quantities of water if it is reverse phase used. Previously, if it is normal phase used, it says will be dissolved in IPA. So, to use intermediate solvent like isopropyl alcohol and flush the system by removing the column and keep the union, then there is no issue of problems. This is not only students, anyone who generally switching instrument from the normal phase to reverse phase or reverse phase to the normal phase, there is a washing protocol you have to follow to ensure remove the previous used mobile phase and first remove, then start with the new mobile phase conditions.
Thank you, sir. So I request the chairperson to kindly summarize the session.
Hello everyone. I congratulate Dr. M.B. Narendra Kumar Alluri Garu for this wonderful presentation on a very important topic relevant to chromatography. Students, you need to understand the outcome of a pharmaceutical research is to develop a formulation, therapeutic formulation, which is having maximum therapeutic effect and minimum adverse effect. That is the aim of the pharmaceutical research. And this can only be ensured if you make sure that at each and every stage of the research while developing this formulation is free from impurities, free from chemical reactions, free from any untoward, unprogrammed step which interferes in between, so that what we plan to initiate, we are getting the desired outcome. During his presentation, I came to know that he just linked this chromatography with QBD DOE designing, which is a very, very important concept. It just made me memorize the day of during my PhD viva. Sir, I just want to share one of my experience. When I was delivering my presentation, I have developed a chemotherapeutic formulation for targeting the drug to the colon. I have designed nearly 36 formulations by using 4 different formulations and different quantities and different composition. And 36 formulations means each formulation was prepared in triplicate, and I have done nearly 10 evaluation tests for each formulation, means I have done nearly 1000 evaluation tests. You know what the examiner who is sitting in that hall, he asked me, why didn't you prepare, you just in your entire research by design of experiments? It might have reduced your task. If you would have done by this QBD DOE, instead of preparing 36 formulations, you would have just completed your task having a desired outcome with just 5 to 10 formulations, because QBD DOE, as said by sir, just while you were sharing in the presentation, it helps you to design the experiment based on pre-programmed objectives with a focus on expected outcome. What we expect, we just try to get at the end, the end outcome. So this reduces our task, hard work, and based on this chiral chromatography, as we also discussed that these impurities are not just found in the raw materials, but you can also find them during the intermediate stage. It can be a source via the solvents, it can be a source via the catalyst, while during the chemical reactions. And in any process, it may be the possibility that the impurities can come in between and they can affect the final outcome. Maybe your experiment is okay, the composition okay, but still the therapeutic objectives will be different. And this child chromatography not just it helps to ensure that we are separating the enantiomers, as you all have seen that enantiomers are the mirror image forms of each other. They are not non-superimposable, and based upon their different elution rates, they are separated from the column. And as if we have seen that they travel at different rates. And moreover, in his presentation, he has focused his concentration on the daily limit of the doses and upper and lower threshold levels of the impurities, as well as the regulatory guidelines with special focus on International Conference on Harmonization. So thank you very much, sir. I was hearing the presentation. I'm from pharmaceutical specialization. Maybe I cannot try to understand up to that extent, but I did my level best. Thank you very much for one wonderful presentation. Thank you all. And students, I just want to inform you what is the importance of this international symposium. I think it will provide you a platform to exchange your knowledge, exchange innovative ideas, and interact with the eminent people and with the students as well as faculties from different colleges who attends this conference, and you can just collaborate for your subject as well as for your research. So please utilize this opportunity. Thank you. Thank you.
Thank you, sir. Firstly, thanks to Narendra Kaluri Garu for such insightful session, as well as Dr. Mohammad Abdul Hadi sir for not just summarizing about the session, also about importance of attending the international conference to the students. Thank you once again, sir. On the same occasion, I request our Honorable Dean sir to please come onto the dais and felicitate both our guests of honor. Once again, a round of applause from the audience, please. Thank you to all the guests of honor of the day for accepting our invitation and making all the sessions such insightful for the day. Can we have all the staff members as well on the dais for a quick group picture? All the faculty members, please come on to the dais.
Ma'am, please come close. ఓకేనా రెడీయా తీసుకో Yes, ready, sir. Done.
Thank you, everyone. We next have online sessions, but meanwhile, all the participants who have their poster presentations, please be informed that we are starting our poster presentations right now. I hope you have already received the information through your mail, and please also note that the post-lunch session will be resumed by 1:30 p.m. So we have our speaker already connected online. So it's a pride for me to introduce our speaker, Dr. Arun Kumar Subramaniam Garu, who is a postdoctoral research fellow, Integrated Therapeutics and Drug Discovery Lab, School of Pharmacy, Sunway University, Malaysia. He's a highly accomplished researcher in neuropharmacology and translational drug discovery, with a focus on Alzheimer's disease, autophagy, and gut-brain axis. Dr. Subramaniam Garu has demonstrated consistent academic excellence throughout his career, being a university first rank holder and a gold medalist during his Bachelor of Pharmacy and graduating with distinction in his master's degree. His research contributions are reflected in a strong publication record in reputed international journals, along with patents in the field of drug discovery and biomedical innovation. His work has received multiple awards for best oral and poster presentations at national and international scientific conferences. His expertise spans in vivo and in vitro pharmacological studies, including rodent and zebrafish models, behavioral and molecular analysis, as well as advanced computational techniques like molecular dynamics, molecular docking, network pharmacology. In addition to his research, he is actively involved in mentoring students, securing research funding, and fostering interdisciplinary collaborations aimed at developing novel therapeutic strategies for neurodegenerative diseases. Hearty welcome to you for this conference to the online session, sir. Over to Dr. Arun Kumar Subramaniam Garu. Dr. Arun Kumar Subramaniam Garu already available online. please check if it is in mute. We are unable to hear you, sir.
Is it on?
So, coming to what is the role? This is like a very basic deep English should be this is a natural, biological, synthetic, or synthetic cells, and this is the diagnosis, prevention, doing complex and disease, then in some cases, it is to diagnose so we have sources of drugs, and these are the focus. So we have sources from the research and we have a permission and this third is the all drugs, but not all drugs. This is the development that should be addressed. When we have the thing like research product that is just there are ideas but still we do become new discovery that there is continuous new speakers and existing drugs that they do have commercial and do that because of these things we do So we have to the success of the study when you have like higher encourage the discover is good that the impact of it would have within the number of crossing on a state that discovery I just sounds very good and coming to this entire conventional way that is and way that is very during this convention that is this randomly it is some natural school that is and they are mostly unique this is not very there is a study where we started like and where still so we went to the school so when study and we have to complete where we have to then we So this is the machine learning. The refers to the ability to experiment and actions to understand process and measurements, plan and methods to data. That is, machine learning has not been the but when it's constant, we learn that the patterns and make control decisions without going explicitly on a paper. I can get all make prediction of the child, the parent, then we do it the data and the paper and we just and we get that program, we do it there, and we do that. This is the question that there is generally this is we will put the data and we have the data that will have the specific and it will do that. So this can we get this so coming to applications of data, we have pictures again so here we so definitely you can any challenges you depend on some problems or you come to this so when you manage this difficult problem within you have network fully developed for that so this way can help you to design this TV so that it is easy for you to understand and so that it will be a good match of your life and you can do what is possible, what is not, what is you don't have to make it happen practically. So all these things can be clearly able to be like you can try to find out these things using this AI intelligence. So in future in the other slides, I'm coming to find out which will be able to have a study. So all these people might be aware of this, if not you can like make more of this as well. So we have like chemical, zinc, processes like we will get to have all the contains data of compounds where it was already in the literature and zinc is like to virtually seen some compounds and that is like all these available plants, available like all these analyses are in the content data of the existing compounds of plants. So coming to this molecular class of molecules, we would need to add the chemical chemistries, medical designer, as well as drug, molecule stage. All these are to assist you with this drug and editing molecules so that it is possible for you to reduce a chemical group structure from a compound and you can add some other subgroups to that and you can talk to the possible to this. So coming to the next is we have this accurate prediction factors starting with sustainability, PKCS, accurate SAR, PED, service, all these are good which can be used for this accurate toxicity prediction. And we have a target or activity prediction tools like PASS online, target counter, Swiss target prediction, and chemical. And we have like a recent topic evolving using the system biology, this is like pharmacology. Now most of the journals they do accept papers, even few journals they do accept papers if you proceed with this pharmacology technique. And we should have ISACPR. All these factors can be used and also you have some base factors as well as school as well. But still not have these are the factors that are included in the study. So apart from this, you have some tools like Discovery Studio, and also USC and these are tools which can be used to visualize the which can be used to check how stable is the talking, how stable is the linear complex to find that. So coming to our important So the things what I'm going to show you now, it is like mostly integrated more in this use. So first we will discuss about this use for target identification and selection. So this is like a very widely used thing to identify this disease targets behind the disease. So identifying the target regarding the disease is like very important actually. When you do work on this drug discovery, identifying the target is an important goal. So for that you can use this tool. And you have gene cards here. When you go enter your disease name in the search term, you will be able to get the list of disease genes which is involved in the disease. So that from that it will be able to identify the potential gene which is unexplored and you can get to work on that. Also you have this development targets platform. This is also a new platform which is systematically designed to identify this target identification and prioritize your target. The potential target among the existing targets, or you can say you can get to find the unexplored and lesser explored targets from this software. So this is how it works. So you have a search page where you will be able to disease name and you will be getting to have design results displayed like this. From this plot, you will get to know how correlating this particular target is the target disease, and you can get to find the correlation, and also this you can get to find the unexplored target or less explored target, and it is easy for you to focus on the study with this tool function. So coming to the next one is like the other thing which is like target importance and target explorer. This is to visualize the interaction between the potential targets. Where is like markings like blue, green, red and gray, which indicates the compound after identifying the target, whether the target is an macromolecule or it is like small molecule or it is like classical molecule, it's standard mechanism, and it is just like a potential protein. So this category of the targets could be easily found through this tool. So this is how the platform works. So when you enter the target name, it will show you a regression plot. So based on this plot, you will be getting to have this plot like blue, green, red and black plot will be there. So from that, mostly people do like this in the real time, especially for the students. And you have this gene thing as well. So this is to find the pattern gene interaction. So generally when you find this target of the disease, which particular disease target are going to work with, but still there might be a chance that disease target will have an interaction with the gene mechanism triggering particular thing, because like it is mammalian target mechanism. So when that is activated, it can get to lead to other disease progression and also inhibition. So for example, it has major roles in many diseases like Alzheimer's, cancer, even obesity, and other mechanisms as well. So with that, to find whether your identified target is having interaction or like it is interacting or like it is having correlating it is with other mechanisms or with other genes, then we can using this particular tool. So coming to the next one is like we have this only which is online video learning implements in that. So here you will be getting to check how interaction is disease target with the gene. So all these are like various tools that can be used for the same purpose. But I will which one like this? Like all three will actually one are user friendly, but the information what you get from these procedures application, it will be like that is like it will be considered the application. And we have this new software which is like panel mix. So this is like mix software where you will be able to see proteomics, genomics, biogenomics, all these omics data will be deeply studied using it. And this is the export area, and it is the lab because of this kind of institutional name, we will be able to get that this time as well. And here this will be through this mechanism, it will how possible and how we can your genes with other genes. So basically that we focus on just impact of genes. It is it is not going to add any development cycles for that. We can have a pattern like a plan for that for the disease. So coming to the next part is we will speak about the which one we can selection and processing new industrial. So here on the same time again which is public sector. It will be having all the available in class and we are able to find the existing phytochemicals from the plant which is already included in the nature. And this is like another thing that we have is medicinal Chinese medicinal system, pharmacological and analysis platform, which is also finding Chinese medicinal plants. This again can be used to explore plant compounds or even plus explore plants as well. So that coming to people don't use methods of much. Yes. Process to have great potential for this service. The economy was needing to be looking at many R&D and finally very important these days. So as a researcher, I submit my users or studies to work at my project so that we can get to have some new components coming from this part of the source that we actually. So these are like some list of variables that can be used for this process, starting from deep K, deep box, we have deep neural net, QSAR, organic, potential net, deep textile, neural graph fingerprint, alpha learning can do that. So all these that I mentioned, the factors of the graph is being used for. And all these things, alpha is very important because it is better than Google to identify the potential dynamic side target before posting several people posting the dynamic target without checking the dynamic side, active side. So this alpha code will be used to identify the potential 3D structure of the protein and the dynamic side. Then if you are using your tracking, the result will be much more specific and will be so next one is like we are this way used for chemical synthesis like including this big filter, reagent, IBM, RXL for chemistry, ASCOS. All these are tools which you can use for chemical synthesis actually. This is like an important part. People mostly this thing you not get to discuss. This will be discussed by people that because like this can be helpful for you to decide a new stream. So for example, if you use this IBM RXL for chemistry, you will be able to predict the chemical synthesis and the pathway, and you can get to know how feasible it is to prepare a stream for the chemical products. Even nowadays, most of these pharma companies that are putting on this tools to predict the chemical synthesis and the pathways and to connect it to the products. So I guess that these potential tools will be in the future and that's how it will be done. So we can make a lot of this and we can use this tool in the service that was needed. Coming to this mining TV, this is technically was in grade 5. Potential is that you can apply that business and that with the existing compound and expand it. So instead of repeating the standard procedure again, we can improve the compound using this method. When you enter the protein area, it will show the existing compound and you can get the results of that. And you can apply that in that would be acceptable and even go inside the school for your publication as well. And you have this new issues of discovery. So this is also a new development tool which you can identify whether the record is having any cytoplasm, some intuition, and if it is having any skills and stabilization, and if it is going to another is getting to this nature, and this one is getting to this synthetic nature, and that will be clearly exhibited in this in this part. This will get very useful and you can identify what speaking the data because of this particular kind of design design data. Coming to this part of design this any so that is nobody is just to find the activity of this kind of these are looking at the so this is actually really so I think we need to work on that. So without having these ideas when you start a study, it will be very tough. When you have these institutes supporting everything, it will be easier for you to proceed with even multiple clearance as well. Because another thing will be doing a kind of this, I will go out and this to get this technical clearance from pharmacology people, especially so when you have these data, preliminary data, institute data, usually evidences that can have data development of control software system and input on that happening can accept and give you the clearance and very easy for you to use it. And we have this this is to begin like how toxic is that and which particular is toxic in this particular through this tool, and this is also very important when you proceed with this ethical clearance and studies. And coming to this principle we have the next tool, this is to predict how to use specialty in this how compatible it is with the humans can be predicted through this tool. So these are tools that we can use for this study. Using these things will help you to capture the mind to come up with a new way. Not much faster as well. So the instruments are this data analysis which can be done very fast. So since we use this way, it is not that we need to sit work on each component or carefully. If you feed the data to the system, you will get the results done exported from the system, from the software. So it will be easy for you to proceed with the things. And it is the virtual screen. You have to learning to do it with hands-on learning. You will be very less. So you will be doing it in the system. And specifically, you can identify the target. And obviously, it is not going to cost you much. And that is also it is going to take up less time and not enough conventional procedure. And the limitations are with how quality is your data. It's a very big question mark because when you have data given to everyone, it's not that you can specifically identify some specific data. But now, most people are working on these tools with the institutes that IIM is working on these things. I hope that in the near future we'll have tools that will compare specifically on that. So this limitation will be eradicated with some which are this. And this ethical concern, you do have this ethical concern because when you have this unity and CO and diverse studies, you do have the ethical goals. But as of now, there is no ethical clearance or ethical board concerning this in silico study. But I hope in the near future, since people are working on this AI and all this machine learning techniques, I hope I will be requesting this soon, we will be requesting this soon in the near future. We will be getting to have all this ethical clearance practice that we will see as well as in the future. And this validation and non-performance study, even today, it is not that everyone will be very familiar with the tool with the system that we have. So this again is a very big limitation. They are using that. And also the lab is not a power. Once like labs, they can just like you don't know if it is valid or not. It is again a very limitation. And these things will eliminate the usage of AI in drug discovery. But I guess that some points we are working on as the team, I guess that I am working on this level pharmacology part. I will not like I can integrate this discovery lab. So my take-home message here is AI is not replacing scientists, it is empowering researchers to discover safer and more effective drugs faster than ever before. So we don't need to worry that whether we will be replaced by AI. It is that we are getting help, and it is that AI will be utilized to make our procedure and the process even at a faster pace. So let me show you the demo of the using the children channel you can show in our slides on the slide. So from the literature, we have working concepts and using these tools. I have shortlisted the concepts and I have used some tools to find this gene and pathway enforcement. By this mechanism and this tool, we will be able to find how your compound is going to benefit the disease and what mechanism or what pathway is going to. So this can be easily identified through this particular pharmacology technique. And this thing, like, we have published the research as well in journal actually. So this toxicology reports journal is like a PR journal and like this chemical and biology is like two journal. So we are using these bioinformatics tools and come up with this new compound and I have designed a new compound and this what my thing is to work with So as a the new compound named as respiratory cyclic molecule against Alzheimer's disease, and this is the toxicity receptor for the same actually. So it is that if you people can use these tools, it is possible for you as an engineer, as thinking agriculture, it is possible that you will be able to design a new scheme using the tool that I have shown you now, and you can come up with a whole compound in these things are like, we have held a paper and the paper is published and it is like, yet to get granted actually. So this is like how potential the AI tool can be in your drug discovery process. So you get to use this AI tool, you can get to focus on coming up with real success if you use them in a potential way. And this is like my Google Scholar profile. And when you go and practicing Google search, you will the results of the people who get this result. Like this, like you can get to see there also in future maybe when you come up with some good discovery using this tools. It is possible. Before AI invention, it is not only if you have an expertise on something, it is possible that you will be able to come up with some new something. But now with some idea on AI, it is possible for anyone with some basic improvement or some basic expertise on this chemical chemistry part or the pharmacology part. It is possible that it is like, obviously it is like a collaborative work. We should collaborate with people. We should get ideas from your like expertise as well. But still it is possible that you can come up with a good product in the future. So with that, we are coming to the end. So thank you for your patient listening. So I will be happy to hear any questions from you. Thank you.
Thank you, sir. That was extremely insightful. I'm sure all the budding chemists who have their research interest in molecular docking and molecular dynamics have definitely jotted down the important points. So if there's any questions, from anyone regarding the topic that Dr. Arun Subramanian you once again for all the cooperation. Let's meet back after the lunch. 1:30. I request everyone to please come back. Of our day. It's an honor to have the guest of honor of the day, Dr. Kantlam Chamakuri sir, who is the Vice President of APTI for the Telangana state. Hearty welcome to you. Please come on to the dais, sir. Apart from being the Vice President of APTI for Telangana State, he is also serving as a Professor and Principal for a brilliant group of institutions. Hearty welcome to you, sir. So please take your seat off the dais so that we can dive into the online session which is left for the day 2. So, can we connect to our online speaker, Dr. Tamrat Balchabala? There's a slight internet issue all the way from Ethiopia, so we are waiting to connect to the speaker. let me call Varshika and team from Family Third Years to present a refreshing dance performance here. A moment to it. Am I audible?
Can I continue?
Sir, am I audible? Dr. Tamrat Kalcha, sir, am I audible to you?
Can you hear me? Hello? Hello? Hello?
Yes, sir. Sir, give me a moment to introduce you.
We are not going to Yes, I'm waiting for your confirmation to continue. Professor Ramana. Can you hear me? Can you hear me? Okay, thank you. Good afternoon, everybody. My name is Tamara from the University. Sorry for the inconvenience of the committee. Here regarding the performance training, so just that to go some. Today, I will present my roadmap. It is focusing on share is the introduction of the presentation. The program is now starting most common outcome that I used to, there was the most and the unity commerce and industries for one factor, including but not the coming to plan, which is a new paradigm of humanity. Recently, the schedule for succession and I've been working on with the two more areas. Here, we have been working on this plan. And today, I will be bringing some of the works and the ways forward. This is the plan. Coming to the application. What is it? I don't think it is necessary to discuss performance because it is going nowadays. Newer structures are looking at to overcome the existing problems of pharmaceutical manufacturing, especially directly functions. Directly functions, weight and regulations are just next to the completion. So the completion, the reason is that the completion problems of weight regulation and regulation in terms of time and resources. In this regard, we opted to use the start from Level 1 to develop the comprehensive start from this plan. And for this regard, we do optimization. And coming to the optimization, central control is very good and it is efficient and systematic design studies. This is in general and the specifics of this research is here. Since the study is not differentially of other elements with the same synthesis, this is a needed. On the other hand, Ethiopia is involving industrial science, which has high economy. Since there is no level knowledge regarding research from the rest of the world, just as was needed. Coming to the objectives of this study, the general objective was to trace this plan to make this people application process so as to have properties for their application. Or habits and finally directly compressed deeper habits using the start theory. Here are the specific objectives. This includes the prepared meeting and optimally regulatory start from 1, 2, and 8 and 3. And also to prepare the environment as being to just stay within certain programs. finally scale and work. Coming to the experimental ideas and methods here are some of the ideas that we did, and of course, the methods include isolation of cell from trigger plant by methods with some people. And the use of materials, chemical products to protein and improvement and other then the start was treating with elsewhere. And some of the physical chemical properties which were characterized include values like leather, and morphology using standard. The identification of and the compatibility with some using FTR expertise to using APR method. This challenge was stated using stereotypy and two density was using most software for contact and the acquisition property drug conduct using differential standard. Direct compression study was just aimed and reducing local complexity and conduct optimization and factors used for optimization were temperature and position. The first properties for direct compression were by changing time and temperature. The responses include the of the data in the by use of active protein and some type of design. Then compatibility and sensitivities were scaling after optimization. To make interactive psychology compare habits, damaging figures, statistical analysis, using good design methods. That's the tool, the software for statistical analysis design expert that includes the second as some contribute to the standard uses and targets coming to the results and the statements. That was successfully structured and it is being on various basis towards 82% frequencies. Here, the table displays the chemical composition numbers here compared to the standard starch, lipid content, protein, here, Coming to the grand stages and shapes, there's a like and the start from the was compared to the start the first week follows that for carbon one, the new step, the second follows the frequency distribution of the sizes of the granules of the it shows that the granule size of the new plant start is by far smaller than that of the start, and this adds some value of value. And coming to the standing of the start here, as you can see, the angular polygonal granules are those of the direct start. They exist after starting the existing groups because of the final sign we prepare the, as you can see, and the shapes of the parallels of the it resembles more like serials, especially crisis rather than our people with substance. Here is this argument for and you can see here are the people versus the diffraction capacity. Values plotted. You can see it shows that A will be 1, the A as a 2 with the size. This person is resembling those size. Here is the model of profile of the start compared to that of the side, and as you can see, that got lower absorption and trend towards the increasing the regular increasing coming to the gelatinization properties, you can see the solid and response to the gelatinization property of the liquid and the protein and the short the trend of also this onset is both state in these molecules and speed of using what to the rate for 6% in terms of 84 by far higher than that of the artificial and this shows there was also one such and better stable terminal stable than the artificial. Coming to the swelling and solubility index, carbon also one as higher, so increasing temperature higher, which are higher swelling power than the start, of course, the trend of solubility index. This is such with respect to our total start change. Medium for 70 the current change is equal to the gelatinization and the difference in gelatinization important points. Here is the technical plot analysis of when temperature versus very problem of the graph. And here is important explanation of this problem. And here is the yield failure rate from the second value of 13 grades. For the optimization of the feeder acquisition was the first, then application start. The second grades were at certain points here one of the controls related to the patterns which are Is there any problem? Can you hear me? This? So, let me do this. Here are the values of the optimization variables at certain temperature and time conditions. These values were optimized in design, and this shows the surface response, and the second, the B shows the control flow of temperature, the effect of these conditions, the temperature and time for constant ratio, and this was put into optimization. The second figure 10 shows the effect of temperature and time on the yield failure, which is derived from the air flow. This shows the effect on hardness and finally on angle of impulse. These were put into and temperature of 66.34 and 20 units exposure was taken as the best combination of time, and these values, these values of the responses were obtained. Finally, after optimization, the optimum start visualization was taken, and it is compatibility with paracetamol that was analyzed using differential scanning algorithm. And as you can see, since there is no change in the peak of relaxation, it is highly related that there can be input or antibody interaction between the pediatric start and here is the report of optimized stage, optimized pediatric stage, and here are important variables. Just this video is very important for the rate of the second infection of the start, and this shows it is fit for the application. And again, the most important content of the physical the most shocking property of people and here you can see this is just the finger is one, and it shows higher muscle absorption than both the big Here are just for the interest of time, the tablet containing pre-development results from better adults and their conclusions. Pre-development results demonstrate significant low criminality tolerance to the antidotes and tolerance higher probability. Overall, the pre-development promises for developing to pharmaceutical great challenge. Here are the ways forward. Just we are striving to continue optimization again and strengthen the organization, scale up data practice, testing, organization, alignment of your centers. We are striving to balance functional evolution and to generate robust data for industrial activities. Provided and finally, I would like to go for collaborations, invite national and international collaborators to advance this product from this great. And here are the opportunities for collaboration. Pharmaceutical combination industrial scale characterization of regulatory services, agricultural optimization of raw materials supply system, technology transfer of product and we hope the partnership to the development of this product market to welcome the industry collaborators. Together we can program and I welcome any questions and clarity queries. Thank you very much.
Thank you, sir. Thank you for the session. If there are any queries, we shall mail you. Thank you once again, Dr. Tamrat Balcha, sir, all the way from Ethiopia. Can we have a huge round of applause for this speaker who has connected us from such a long way? So with this, we are done with these wonderful sessions from so many eminent speakers for both the days. So moving ahead, let me call Varshita and team to present a dance performance here.
It's difficult to get the words out. This is the critical moment. Heart rate, oxygen, motion, and speech data converge. Individually insignificant, but together they form a powerful diagnostic pattern. The threshold is crossed. High risk of stroke detected. An emergency protocol is initiated instantly. GPS and live vitals are transmitted, transforming detection into immediate action. Because in a stroke, every second matters. Paramedics receive full patient data before even arriving, ensuring no time is lost. Reaching the hospital within the golden hour changes the outcome completely.
The patient is stable. Recovery has begun. But this raises an important question. How did this device recognize non-invasive monitoring? Tracks motion, heart rate, and body signals. Using photoplasmography, the device emits light into the skin and measures its reflection.
By using dual wavelength light, the device differentiates between oxygenated and deoxygenated hemoglobin. Built-in motion sensors, including accelerometers and gyroscopes, track movement and balance, even the slightest asymmetries. Built-in motion sensors, including accelerometers and gyroscopes, track movement and balance. The true power lies in integration. Each signal is analyzed individually and then combined.
This is how the device works. We sincerely work on it. Thank you.
A round of applause, everyone. And that was AI integrated wearable ear device for early detection and prevention
same in space?
Drug dissolution is the process by which a solid drug dissolves in a liquid medium before it can be absorbed into the body, making it a critical step
in determining the onset, intensity, and overall effectiveness of a drug.
On Earth, dissolution is strongly influenced by gravity. Particles settle due to sedimentation, while convection currents continuously mix the fluid, increasing contact between the drug and solvent, and significantly enhancing the rate of dissolution. In microgravity, however, gravity is nearly absent. There is no sedimentation and no natural convection, so drug particles neither sink nor mix actively. They remain suspended, creating a completely different dissolution environment. Under these conditions, dissolution depends primarily on diffusion. The gradual movement of particles from regions of high concentration to regions of low concentration, which is inherently slower and more uniform compared to convection and mixing. This behavior is described by Fick's law of diffusion, where the diffusion flux depends on the concentration gradient of particles. The diffusion coefficient in microgravity with convection nearly absent, dissolution becomes diffusion limited, fundamentally altering the rate at which drugs become available for absorption.
However, dissolution is only the first step in a complex journey. Once dissolved, the drug must pass through multiple physiological processes within the body to exert its therapeutic effect.
These processes are collectively known as pharmacokinetics, or ADN: absorption, distribution, metabolism, and excretion, which together determine the fate of a drug inside the human body.
Absorption depends on factors such as dissolution, gastrointestinal motility, membrane permeability, and all of which may be altered in microgravity, potentially leading to slower or inconsistent drug uptake.
In space, body fluids redistribute toward the upper body due to the absence of gravity, which can change plasma volume and tissue perfusion.
Metabolism, primarily carried out in the liver by enzymatic systems, may also be influenced by microgravitological changes, potentially altering the way at which drugs are biotransferred into active or inactive metabolites.
To better understand these complex changes, a young South Asian female scientist uses organ-on-a-chip technology.
Miniaturized microfluidic devices that replicate the structure and function of human organs, using living cells in controlled fluid flow environments.
These organ chips can be used to simulate microgravity conditions, allowing researchers to study how drugs behave in human tissues in space without relying solely on astral testing.
By integrating drug dissolution steps with organ chip models, researchers can observe how altered dissolution patterns in absorption, distribution, and overall pharmacological response at a cellular and tissue level.
This approach provides a powerful platform for predicting drug behavior in space, and supports the development of safer, more effective drugs. On Earth, drug action is supported by efficient dissolution, circulation, and physiological stability,
whereas in space, reduced mixing, fluid shifts, and altered organ function can significantly modify drug performance.
As a result, the same drug and dosage may produce different therapeutic outcomes in space, highlighting the need for
precise and adaptive drug design tailored to microgravity conditions. In space, not only does the environment change, but the human body itself adapts, and so must the science of medicine. Now, this includes organ chip.
Ahead. The Vice President, Association of Pharmaceutical Teachers of India, Telangana State Branch. With 20 years of academic leadership, Dr. Chamakuri Garu is currently the Professor and Principal at Brilliant Grammar School Educational Society's Group of Institutions, Faculty of Pharmacy, Hyderabad. His contributions to pharmacy education are extensive: 34 international, 1 national publication, 2 books, 21 scopus, and 13 UGC papers, with 15 scientific poster publications. He's guided more than 30 MPharm students, more than 15 BPharm bachelors, and is presently mentoring 6 PhD scholars at Best IU at Anantapur. Dr. Chamakuri Garu has served as State Coordinator for the 72nd IPC 2023 Nagpur, LOC member for 73rd IPC 2024 Hyderabad, and Chief Guest, Session Chair, Evaluator at numerous national and international conferences. He is also a NAC Coordinator and Governing Body member across multiple institutions. His excellence has been recognized with the 2025 Professor M.L. Shroff Pharma Recognition Award, Rabindranath Tagore National Award for Higher Education, and the Young Professor Award in Scientific Laurels 2025. A torchbearer of pharmaceutical education, we are privileged to have Dr. C.H. Chamakuri Garu with us at ISACPR 2026. I request our Honorable Dean Sir to please come onto the dais and welcome our Chief Guest of the Day. May I now call upon the Chief Guest of the Day, Dr. Kantlam Chamakuri Garu to please come onto the dais. So before we hear from the chief guest of the day, I request our Honorable Dean Sir to please come and talk a few words before we start off with the valedictory ceremony.
So thank you, ma'am. Yeah. So today's chief guest of the session, so Dr. Kantlam sir, Deputy Vice President, Telangana State Branch, Principal and Professor, Brilliant Group of Colleges, Hyderabad. So I welcome you all, welcome you sir for this wonderful session. Thank you very much for accepting our invitation, being a chief guest for this valedictory ceremony. And the respected all the learned faculty members, my dear the student friends and guests, and even some of the research scholars. So very, good evening everyone. Good evening. Thank you very much. So I think we have spent a lot of 2 days time over here at MRIPS. I think you might have received, you might have exchanged, you might have got some information throughout the sessions, plenary sessions, as well as the poster and oral presentation, both the offline and online. Is it so, right? Yes or no? Yes or no? Okay, if that is your wish. I thought that you might have gained some knowledge being a part of the international symposium, especially focused on advances in chemical and pharmaceutical research. Right. And here I just appreciate the management for providing this wonderful opportunity to conduct the international level symposium at our MRIPS. And also I would like to appreciate the dedication from the organizing committee, not only single organizing committee, starting from the organizing secretary, even different committees are involved in. So without their constant support, that is not possible. So I thank everyone directly or indirectly involving to, giving your support so that we got, good response from the different participants across the nation. And also I appreciate even the students, research scholars, and even, faculty members, those who have come from the different areas, far away from even Hyderabad, and especially Pune and Karnataka and Maharashtra. So I thank very much for your support. All the way you came here to get interacted with your plenary sessions as well as even the presentation. So I would like to tell you one thing regarding the number of admission, number of even registration. 600 more than 600 across the nation we receive the registration. In the 600, 450 are given the what we call poster presentation and oral presentation in the both, and offline and online. So I congratulate all the participants, those are involved in this presenting their presentation, oral and PPT presentation, or even poster presentation. And finally, I would like to congratulate everyone who are present here and supporting in all aspects to making this event grand success. So thank you one and all. Thank you everyone. God bless you. Jai Hind.
Thank you so much, sir. Nothing without your support. On the same eve, let me request our chief guest of the day to please address the gathering.
Very good afternoon. Energy అయిపోయిందా? We are a budding pharmacist, health networkers, respected today's conference convener, Dr. H. Ramana Garu, Dean, MRB, MRIPS, and co-conveners, Dr. J. Sangeeta Madam, Professor, Dr. S. Ravindra Babu, Professor, Dr. N. Karnakar Garu, Professor, and Organizing Secretary of this conference, Dr. K. Teja Kumar Reddy, Associate Professor, as well as our Chief Patron, Sri Chamakura Mallareddy Garu, founder of this MRB, patrons, C.H. Mahendra Reddy Garu, Secretary, C.H. Bhadra Reddy Garu, Chairman MRB, C.H. Shalini Reddy Garu, Director MRGI, Dr. C.H. Preeti Reddy Garu, Vice Chairman MRB, Sri P. Praveen Reddy Garu, Director MRGI, and co-patrons Dr. K.M. Sudha Ramna, Chancellor MRB, Dr. Harihara Prakash, Pro-Chancellor MRB, Dr. Anil Kaur, Vice Chancellor MRB, and Dr. Mantandi Janodia, Registrar MRB, Dr. Karthikeyan Ramalingam, Controller of Examination MRB, Dr. Kranti Kiran Reddy Ella, Director of Research MRB. It's a great opportunity to me to be part of this today's International Conference Symposium on advances in chemical and pharmaceutical research. And as well as I congratulate this organizing committee of this conference and dear faculty members, student coordinators, and most probably the participants from throughout country. This is an international conference. I am very happy to hear that from Maharashtra and Udi, JSS, from prestigious institutions, participants came. It's a very good milestone for this conference, sir, because we are in the front line to grab the attention from the throughout India. Because just now I thought that our pharma era started by seeing the first year pharmacy students who danced here. Because we know everyone, we know about this situation, but I was very happy after seeing these 3 students from the big pharmacy first year, those who are continuously coming to the college and they are conducting the classes, participating. This is the new era for our pharmacy. Every teacher is thinking about that. So heartily welcome to this conference, and I congratulate all the members. So dear students, why this college is conducting the program, why we are participating, why these faculty members are taking the pain to conduct this program. First of all, you should think about this one, because it's not just for 2 days. For conducting this program, nearly 20-25 days work was done. Painfully with all the faculty members, all the coordinators to success this program. So why we have to conduct? So because we have to create a platform to meet the persons from different places, share their views regarding our pharmacy. So nowadays everyone thinking about the non-pharmacy or computer science or anyone regarding the AI. So everybody is using AI, yes or no? Not only computer science, but we are also using the AI. Okay? So knowledge is not for the one part, it is for all. It is for all. So we have to grab the attention at the while going to lectures. Because students has to take the chance, interact with the eminent speakers. Yesterday, Rambo sir came because he is a eminent professor from the Karnataka University. He did so much research work. So you are the lucky persons, because when I was studying B Pharmacy, I was unable to meet the eminent professors. Because it's a witness. Yesterday I met the Dr. D.R.K. sir in Viper conference. Because since my inception of B Pharmacy and after completing my post-graduation, I used to listen about the D.R.K. sir. Whenever you visit KU campus, in that period, 1 or 2 hours, you will come across name of the D.R.K. sir. If you attend any program in Calcutta University related to any conference, definitely sir name should be pronounced in that conference. Why? Because he sacrificed his life to our pharmacy. Now he is doing the research. Now he is in US. Yesterday I met, I was very happy. Because that is our eagerness to meet such a wonderful persons. So dear students, if you are having the willingness, definitely one day you will become in good position in your field. Not only computer science graduates are getting the good opportunities. So you know about the DVC laboratories, Sajja Ramakrishna Rao. So he is the whole and soul person, he is running the units, one and all. You don't know about him. His son, who is his son? Hero. Teja Sajja. You know? His brother is also working in Davis Laboratory. His sister-in-law is also working in Davis Laboratory. I came to know about that family. Because everyone has a knowledge, everyone has a energy to grow themselves. So you don't forget your goal. Every time you should remember our goal and move forward and get our goal. Definitely one day we will become. Just now we saw the lecture. Her name is Tamra Balcha. Tamra Balcha from Ethiopia. Why Ramana sir has that enthusiasm to invite him to give the lecture in this conference? Why? This is a platform to listen different lectures. Yes or no? Sir took this session on starch. Pre-gelatin, taro, balsa one, starch. See, we don't know about the paracetamol. Everyone knows about the paracetamol. Why we took the class on starch? We don't know about the starch. Why we are attending this program? Advances in chemical and pharmaceutical research. Advances in chemical and pharmaceutical research. He done work on starch. He developed one formula. It's a simple, by hearing it's a very simple, but getting the result is hard. But we should move forward and do the research. We have to observe these things in conference. Understood? So why see our students created an AI? They don't have any computer knowledge. C++, C++, Java, Oracle. They don't know, but they created one AI video. If you are having the interest, you can do miracle. For that purpose only we have to attend the conferences. Why should we attend the conference? What will get the benefit? You cannot imagine you can get more and more knowledge. More and more knowledge. See now, we are the budding pharmacists. So at the time of COVID, our country supplied nearly 123 countries vaccine. Everyone want to become a Vishwa Guru. Yes or no? Everyone wants to become a leader to world. But this time Bharat is becoming Vishwa Bandhu. Because of budding pharmacists. Because of budding pharmacists, our budding pharmacists are working towards the developing all medicines which are useful for the society. In the field, our India is having the more and more scope, and now we are becoming the Vishwa Bandhu. So, dear students, I am very happy being part of this conference. I am thankful to the convener, Dr. H. Ramna sir, because he is a very good friend. We used to speak every time. I am very happy seeing all my teacher colleagues in this conference. So definitely, we are having a good platform. Wherever we go, we have to share our knowledge to our society. Thank you one and all for giving this opportunity. Thank you.
Thank you, sir, for always encouraging us. So without much delay, let's dive into the valedictory ceremony of the second International Symposium organized by Malarati Institute of Pharmaceutical Sciences, titled Advances in Chemical and Pharmaceutical Research. May I call upon the organizing secretary, Dr. Teja Kumar sir, the co-conveners, Dr. J. Sangeeta ma'am, Dr. Ravi sir, and Dr. Karnakar sir onto the dais. Please join our beloved Dean sir to felicitate our guest of honor of the day. A round of applause, everyone. Dear audience, as this is a valedictory ceremony, please continuing to applaud all the winners from hereafter. Thank you, sir, for accepting our invitation. I know everyone has been waiting for this moment, so without much ado, let's start with the poster presentation results, starting with the Pharmaceutics, Regulatory Affairs and Industrial Pharmacy Department winners for the poster. Third prize goes to Nagamalesh from NRIPS. Dear winners, please be a little quick as we are running short of time. Nagamalesh and Jayashree. Vizag. Anyone from CMR College of Pharmacy here? Could please come and collect. We have the faculty here. Congratulations to the 3 winners under Pharmaceutics, Regulatory Affairs and Industrial Pharmacy Department. Dear audience, please keep applauding.
Okay, next comes the Pharmaceutical Chemistry or Pharmaceutical Analysis Department. The poster presentations, 3rd prize goes to M. Kirtana from Sri Krupa Institute of Pharmaceutical Sciences. Congratulate all the winners with a huge round of applause. M. Kirtana from Sri Krupa Institute of Pharmaceutical Sciences. And 2nd position goes to Dinesh Mandan from SVKM NMIMS Global University School. Second prize goes to Dinesh Mandan from SVKM NMIMS Global University School. And the first prize goes to Saumyadeep Sanigrahi from JSS College of Pharmacy. So they both are from online.
We next have winners for the Pharmacology and Pharmacognosy Department. 3rd prize goes to A. Jahnavi from MRIPS. Second prize goes to R. Meghna, Tanishka and Dakshayani from CMR College of Pharmacy. That's from CMR College of Pharmacy. And the first prize goes to Kalyan Vaishnavi from MRIPS.
Next comes poster presentations from Pharmacy Practice Department. 3rd prize goes to Jyoti Pradhan from CMR College of Pharmacy. Jyoti Pradhan from CMR College of Pharmacy.
Anyone on behalf?
Congratulate the winners. 2nd prize goes to K. Dheeraj and Vinupna from MRIPS. Dheeraj and Vinupna from MRIPS.
Guided by our very own S. Ravindra Babu sir. So I request the dignitaries to please give away the certificate and the cash prize to the guide.
And the first prize goes to Kovida Kovi from CMR College of Pharmacy. So huge round of applause. for the first prize winner, Povida Povi from CMR College of Pharmacy.
Last but not the least, the best performance under oral presentation goes to Sneha Pawar from Datta Institute of Pharmaceutical Sciences, Pune. On her behalf, if anyone could please come and receive. Congratulations to all the 17 winners. We are proud to have you as the winners under the second International Symposium. Congratulations for winning that certificate as well as the cash prize. Moving ahead, a certificate of appreciation also goes to our sponsors. We invite I-20 Fever to please come onto the dais. A big thank you to all the sponsors. I-20 Fever, followed by IV Overseas. We also have Sin Pharma Research Lab as a sponsor. Asian Scientific Instruments.
And S Pharma Education, as well as OPPO. IV Overseas, Sin Pharma Research Labs, Asian Scientific Instruments, and S Pharma Education. And OPPO.
Thank you to all the dignitaries on the dais. May I now call upon the co-convener, Dr. J. Sangeeta Ma'am, the Vice Principal of MRIPS, to please present the vote of thanks. Before the vote of thanks, I request our Dean Sir and Chief Guest to please come forward to present the certificate of appreciation to the convener and co-convener as well as the organizing secretary of our second International Symposium.
Madam Side, sir.
Can we have a huge round of applause for the convener of second International Symposium on Advances in Chemical and Pharmaceutical Research? That's our convener, Dr. H. Ramana Garu. Calling next is our organizing secretary of our second International Symposium, Dr. Tejakumar Reddy Garu. A round of applause, everyone. Next, calling upon our co-convener, Dr. J. Sangeeta Ma'am, Vice Principal. Dr. S. Ramanbabu sir, Head of the Department Pharmacy, as the co-convener for this international symposium. Another round of applause, please. Another co-convener, Dr. N. Karnakar sir. So this is a we have two evaluators. May I call upon Dr. Nagarani from Sri Krupa Institute of Pharmaceutical Sciences, who has evaluated one of the scientific sessions. May we also call upon Rajesham sir from CMR College of Pharmacy, who has also May I now call upon the co-convener, Dr. J. Sangeeta ma'am. We also have another evaluation certificate to be presented to Dr. Mohammed Hadi sir. So, considering the contribution that all the staff members have done to the Second International Symposium, our organizing secretary has a special word of mention to all the faculty who is involved in various committees. A special thanks to every faculty and a staff member who was involved directly or indirectly in this success. May we have entire faculty and the staff members to please come onto the dais for a very quick group picture. Sorry about this interruption. May we have the vote of thanks first and then we'll have the immediate group picture. So for the same, I request Dr. J. Sangeeta ma'am to please present the vote of thanks.
Thank you, Revati. It gives me great pleasure to deliver the closing remarks for this successful and intellectual. intellectually enriching international symposium. Over the course of these sessions, we have witnessed a remarkable convergence of knowledge, innovation and interdisciplinary collaboration in the field of pharmaceutical sciences. We extend our sincere gratitude to all our distinguished keynote and plenary speakers, including Professor Devraj Rambo sir, Dr. Sudhir Kumar, Professor Mujibudin Sheikh sir, Dr. Chella Suresh sir, Dr. M.V. Narendra Kumar sir, Dr. Lamrat Balcha and Dr. Arun Kumar Subramanian, whose insightful presentations covered cutting-edge topics ranging from nanotechnology and natural products to artificial intelligence-driven drug discovery and advanced analytical techniques. Their contributions have truly enriched our understanding and inspired future research directions. We also express our heartfelt appreciation to esteemed session chairpersons, including Dr. A. Madhukar, Dr. Reddy Sunil sir, Dr. D. Varun sir, Dr. K. M. Rao sir, Dr. Muhammad Abdul Hadi sir, for their effective moderation and valuable insights, and for ensuring the smooth conduct of each session. Their leadership played a vital role in facilitating meaningful discussion and knowledge exchange. We extend our sincere thanks to Dr. Krishna Mohan Chinala sir, President APDI Telangana branch, and Dr. Kankalam sir, Vice President APDI Telangana branch, for their guidance and association. We express our profound gratitude and support from our beloved founder chairman C.H. Mallareddy sir, patrons, co-patrons of the conference. We sincerely thank our management, Mallareddy Vishwavidyapeeth and Mallareddy Group of Institutions for their unwavering support and encouragement. We greatly acknowledge our sponsors, Ex-Pharma, Sinpharma, IB Overseas, I-20 Fever, OPPO and Asian Scientific for their generous support. Our special thanks to our publication partners, Printer Nature, for enabling the global dissemination of research contributions. We also place on record our deep appreciation to the organizing committee, administrative officer, office in charges and all supporting staff for their tireless efforts and dedication and teamwork in ensuring the seamless execution of the symposium. I would like to thank all the participants from various colleges, to mention especially the CMR colleges, where we had almost around 75 to 80 participants who have been initiated by our own faculty and CMR faculty. Namely, I can say Revati ma'am, Shweta ma'am, Swati Sulpa ma'am, Harini ma'am, who have initiated this. Apart from that, we have other colleges also who have supported us in this and contributors for their various active engagement, enthusiasm and collaborative spirit, which truly made this event a grand success. As we conclude, let us carry forward the knowledge, new collaborations and continue striving for excellence in research and professional practice. I wish you all continued success in your academic and professional endeavors. Thank you all.
Thank you, ma'am. May I now call upon all the different committees to please come onto the dais with your group of volunteers, starting with the registration committee, Dr. L. Jyotirani ma'am, Mrs. P. Shravanti, Dr. M. Anusha, Mrs. Shruti, Mrs. Rajita and Mrs. Indraja Naik. Definitely, a round of applause goes to all the effort done by every faculty in indirectly or directly in the form of certain committees. We next have the Scientific and Souvenir Committee, Dr. The photographer to do a very quick job, please. Mrs. Shruti, Mrs. Indraja, please join on the dais for a group picture with your committee members. Can we also have the registration committee volunteers? Next is your Scientific and Souvenir Committee, Dr. J. Sangeeta ma'am, Dr. S. Ramendra Babu sir, Dr. N. Karnakar sir, Dr. Lakshmi Madhavi ma'am, Dr. M. Shweta, Dr. S. Markatam ma'am, Dr. Sudhamani ma'am, Dr. Swati Swarupa ma'am, Dr. Seksha ma'am, and Sarika ma'am. Sarika ma'am. Volunteers of the Scientific Committee also to please come onto the dais. As the buses would be starting, I guess the volunteers have already left. The entire team of Scientific and Souvenir Committee. A round of applause from the audience, please. Moving on, we have the stage committee. Myself, Mrs. Revati, Dr. Y. Sivisha, Mr. Rama Rao, and Mrs. Sushma, as well as Mr. Shekhar. Can we also have the volunteers on the dais? All the members of the stage committee, including the volunteers, please. Shekhar sir, Sushma ma'am, Sirisha ma'am, Ramanao sir. Can we have a round of applause for the stage committee, please? Thank you, sir. Thank you so much. We next have the hospitality committee. Dr. Ashok sir, Shukla sir, Sunanda ma'am, Shekhar sir, Mrs. Harini, Ms. Indraja, and Mrs. Hospitality committee volunteers.
Yes, ready, sir.
Next,
Yes.
Scientific and Souvenir Committee.
Yes, ready, please.
Members and volunteers, please be ready for the group picture. Dear audience, please do not be partial to any committee members. Please keep applauding. to keep the energy alive in the room. As we also have the volunteers of the scientific committee who were a little late for the picture. Next, discipline committee, Dr. Ravi Kumar sir, Mr. Sampath, Mr. Shekhar, Mr. Prasad, Mr. Vijay, Mrs. Lakshmi Sureka and Mr. Suresh. Please be ready for the picture with your volunteers on the dais, please. That's the discipline committee. Round of applause please for the discipline committee. As I said again, please do not be partial to one particular committee. A special mention goes to the examination in charges, Mrs. Monica and Dr. Sati sir, to be on the dais. We next have the certificates and mementos committee.
Yes, sir.
Calling next is the certificate and mementos committee. Dr. Kavya, Mrs. Swapna, Mrs. Shravani. Next we have accommodation and transport committee. Mr. Shukla, Dr. Ashok, Mrs. Priyadarshini, Ms. Harika, Dr. Lalita Shrivani. Media communication and report writing, Dr. Swapna, this is Revati myself, Dr. Nagasai Shamala, Mrs. Monica, Mrs. Mahalakshmi, Mrs. Pranusha. Media and report writing committee, please don't be partial, kindly keep applauding. Dr. Swapna. Mrs. Monica ma'am, you are into report writing committee. Goes on. Huge round of applause. Please wait for the news by evening. May we also have the technical department, Mr. Ramesh, Mr. Sagar, Mr. Prem Kumar, we request both the videographer and the photographer also to please join the same team. Wherever Hari Krishna is also to please join the team. A round of applause everyone for the technical department.
Camera time pass.
Thank you to all these members.
వీడియో వస్తుందా? వెంకటి వేణి
Last but not the least,
అంటే వీళ్ళు అన్నిట్లా
last but not the least, the winners of the 2-day session, the anchors. Dr. Sirisha and Mrs. Revati. That's myself, brackets. The anchors of both the days.
So thank you everyone. Actually, without them, without these two, without them, it cannot possible, right? So good admin, good management. So thank you very much.
Huge round of applause for Thank you, sir. Thank you everyone for the support always. In case we missed any name, please forgive us. In case anyone has missed coming onto the dais, you can please come. You're welcome. If everyone has done with the job, I request all the faculty members to please join us for the quick group picture. Please do not come and fight for places. That was on a lighter note. Sangeeta ma'am, Sirisha ma'am, Vijay sir, everyone please come onto the dais for a quick group picture. Ramesh, to please turn off the projector. Janvi. Some of you can please also come here. Some of you can please come here as well. Some of you can please also come here. What a beautiful sight it is to see the entire pillars of MRIPS. The minimal audience we have, can we please expect a good round of applause for these pillars on the dais? Alright, say cheese. Say samosa.
Yes, ready, sir. Smile. Wait. Done.
We wholeheartedly thank Dr. Kantilam Chamakuri sir for gracing this event as the chief guest.